Guided Imagery for Self-Healing by Martin L. Rossman, MD. An essential resource for anyone seeking wellness. Acknowledgement. Certain people have played especially important roles in the development of my understanding of imagery and healing. I am eternally indebted to Irving Oyl, Doctor of Orthopedics, who first showed me the healing power of thoughts and images by working wonders with patients in front of my skeptical eyes. Rachel Naomi Riemann, MD, has made major contributions to this book and my life as a teacher, colleague, guide, and friend. She reminds me without fail that life and healing are journeys of the soul. David Bressler, Ph.D., my partner in developing guided imagery training for health professionals, has taught me a great deal about imagery and teaching, and has long encouraged me, as both friend and colleague, to write this book. Tom Yeoman, Ph.D., a master teacher and guide, has helped me to understand the healing process at the deepest personal levels I have been able to explore. I want to especially thank Ken Pelletier, Ph.D., not just for taking the time from his busy schedule to write the introduction, but for his consistent and generous support of my work through the years. Foreword by Dean Ornish, medical doctor. Your mind and body communicate in images. This dialogue is going on all the time, sometimes in healing ways and sometimes in harmful ones. Although much of the time you may not be consciously aware of it. Like any form of power, imagery can be used for healing and for harming. For example, if you remember an argument that you had with a friend yesterday, your body reacts today as though you were still fighting. Close your eyes and remember the last time you argued with a close friend or a loved one, and pay attention to what happens in your body. You may notice that your breathing has become more rapid and shallow, and your muscles have tightened and your heart is beating faster, and you feel anxious or disturbed. Now remember the last time you felt close to a friend or loved one, or imagine a peaceful scene. Once again, pay attention to what happens in your body. You may notice that your body has begun to relax. Your breathing has become deeper and more regular, and your heart rate has slowed, and you feel good. Meditative and yogic approaches that are thousands of years old can be very useful in learning to quiet the mind and the body through methods that are highly effective, yet gentle. Now, these approaches use attention, intention, and imagination more than will to create desirable changes. Imagery or visualization is an applied form of meditation. In a directed way, imagery may influence physiological processes that enhance healing. In a receptive way, visualization may help you access deeper parts of your inner wisdom. In my experience, both approaches can be very helpful and practical. Dr. Martin Rossman has been a pioneer in the uses of imagery. He is considered by many to be one of the world leaders in teaching people how to use imagery to help facilitate the process of healing. This book and the tapes that he has created are very useful tools for learning to use guided imagery for stimulating your own healing. Now, the instructions are elegantly simple, yet may lead to profound realizations and help activate your innate ability to heal. He has a gift for making it usable to people with widely varying beliefs and experiences in life. His life work has been to empower people to participate in their own healing. The pages that follow contain both wisdom and practical instruction from a talented teacher who has used these methods in a lifetime of medical practice, yet who understands and respects that everyone has their own unique path to healing. He teaches the skills that allow you to effectively use guided imagery for your own healing. in a way that allows you to find your own individual path. Introduction. Kenneth R. Pelletier, Ph.D. Beginning in the early 1950s, researchers and clinicians in Europe, Japan, China, and the United States began to explore systematically the important role of imagery in determining an individual's health or illness, and perhaps the course of her life and death. During the past 3 decades, findings from several areas, basic stress research, biofeedback instrumentation, the clinical use of relaxation, and most recently the emerging field of psychoneuroimmunology, have formed an extensive body of knowledge indicating that psychological factors can and do significantly affect the physiology of the body. Presently, 3 convergent lines of inquiry underscore the importance of mental imagery in mind-body interactions. First is the basic research in psychoneuroimmunology, which is the rather cumbersome term used to characterize the investigation of the interactions between the mind, that's your psycho, and the brain and nervous system, the neuro, and the body's biochemical resistance to disease and abnormal cell development, which is immunology. Since the early 1980s, data from this discipline have brought new insights into the way that psychological elements can contribute to allergies, to susceptibility to ailments ranging from colds to cancer, and perhaps to the mechanism underlying AIDS and spontaneous remission of many diseases. Another important advance in basic research has been the development of second-generation imaging technologies such as PET, positron electron tomography, and NMR, nuclear magnetic resonance, which can produce pictures of brain activity with increasing specificity. Together, these 2 developments unequivocally indicate the variety and subtlety of mind and body interaction. Medical technologies have begun to provide the basis for observing how and why imagery exerts its influence in healing. A second line of inquiry is a growing body of clinical experimental research that serves as a bridge between basic research and its eventual widespread application in daily practice. A measure of the importance of this research can be found in an article in the Journal of the American Medical Association, William H. Fauget's Public Health and Prevention Medicine, October 25, 1985. Now, this article pointed out that about 2/3 of the deaths in this country are premature, given our present medical knowledge, and that about 2/3 of the years of life lost before the age of 65 are theoretically preventable given our current capabilities. Later, the article states, in the coming decades, the most important determinants of health and longevity will be the personal choices made by each individual. This is both frightening for those who wish to avoid such responsibility and exciting for those who desire some control over their own destiny. In short, changes in our behavior, both external and internal, can reduce the large number of premature death and illness and lead to better health and a longer life. Clinical research has already demonstrated the impact of behavior on disorders ranging from advanced heart disease to chronic pain. Behavioral approaches to illness give individuals the means to improve their health through their own efforts. Central to such approaches is the informed application of relaxation techniques and visual imagery, sensibly coordinated with appropriate medical and psychological care. A third line of inquiry into the effects of imagery on health brings us directly to the basis of Dr. Martin Rossman's superb book, The Day-to-Day Clinical Applications and Experience of Skilled Practitioners such as Dr. Rossman, who fuse insights from basic research and clinical experimental studies with insight, compassion, and incisive clinical judgment in their effective patient care. When I first met Dr. Rossman in 1974 during a conference at the UCLA School of Medicine, I was struck by his dedication to the healing profession. And throughout our continuing collegial relationship and personal friendship, I have remained deeply impressed with the caring he exhibits to patients, colleagues, and friends. After more than 15 years as a general practitioner, he has now distilled his insights concerning the healing role of imagery and the process of communicating with what he calls one's inner advisor into an accessible, practical, and effective book for both patients and practitioners. What a unique thing about this book is that although it teaches practical skills that are applicable to a wide range of disorders, it's never glib or simplistic. An especially helpful feature of the book is that it addresses and suggests resolutions to the problems that sometimes arise as individuals begin using imagery as a form of mind-body communication. Dr. Rossman gives appropriate due to patients' resistance and looks at it not as an impediment, but as the voice of the loyal opposition that can offer an individual great insight into why he or she needs a disease or symptom. Dr. Rossman also shows how a patient can use the technique of imagery to clarify the choices they have made that can undermine health and then to rectify them, often with a profound and positive impact on one's attitude and physical being. It's important to recognize that Dr. Rossman's use of imagery and his treatment of an inner advisor have a rich lineage stretching back thousands of years across many cultures. Enlightenment or awakening attained by inner guidance is a central element in ancient religious systems, ranging from the Tibetan Buddhist to Native American beliefs to the hierarchy of guardian angels in many Western cultures. Now, although these traditions may seem far removed from the daily practice of modern medicine, Dr. Rossman's book presents an eminently practical application of many of their most profound insights. And one of the greatest periods of Western science was the 18th century, the Enlightenment time. Significantly, this period arose from the fusion of inner exploration and outer knowledge. And this book is about the kind of fusion which can be a major step toward enlightenment and healing for anyone willing to engage it seriously. Preface. This is not a pie-in-the-sky book. While it's about imagining, it's also extremely practical. This book will teach you a step-by-step method of using your mind to help further your own healing. You'll learn how to use mental imagery to achieve deep psychological relaxation, to stimulate healing responses in your body, and to create an inner dialogue that can help you better understand your health and what you can do to improve it. I've taught this method to thousands of patients and health professionals since 1972. It can be helpful, though not always curative, in 90% of the problems the people bring to a primary care doctor. Now, in the chapters that follow, I will describe my introduction to the healing powers of imagery, and I will present a model of how imagery works, and I will share with you the healing I have witnessed in people who have learned to use this powerful tool. I'll also describe the 9 imagery skills that I have found most helpful, and then provide scripts to help you learn each skill. In addition, I will address the stumbling blocks and the questions that most often arise when people begin to use imagery for healing. Finally, I have provided 2 appendices that include specific suggestions for treating various conditions as well as a list of resources that you may find useful. Healing is sometimes treated like a dirty word in medicine, and some feel the term smacks of mysticism and quackery. Yet healing is a natural property of life. Healing happens because our integrity at every level, from the cellular to the psychological, is constantly challenged by life's changes, and we, like all living organisms, need to maintain a steady state in order to thrive. Without our innate ability to restore, replenish, and repair, our life could not go on. In many ways, life itself is a continual process of healing, of moving toward balance and wholeness in the midst of change. There are many ways you can help or hinder this natural process. The quality of food you eat can profoundly affect your ability to heal, as can the kind of air you breathe, the drugs or medicine you take. Rest often supports healing, as does appropriate exercise. Your environment and social relationships also have an important effect on your health, as do your own thoughts and feelings, and the way you use your mind. This book is about the mental aspect of healing, the effects of your thoughts on your physical, emotional, and spiritual well-being. It will teach you specific ways to use your imagination and will to cooperate with your body's natural desire and ability to heal. There is something for everyone in this book, and whether you have a chronic or a serious illness, or have a primary interest in health and wellness. Before you begin, let me give you 2 words of caution. First, the self-healing techniques you will learn in this book may allow you to be more independent of medical care, but they are not a substitute for it. Getting a good medical assessment is an important part of responsible self-care. If you have a symptom or illness that seems serious, or one that is persistent or recurrent, see your doctor for a diagnosis and recommendation for treatment. If you're unsure about your doctor's advice, seek a second or even a third opinion. You may also want to explore treatment options with qualified, ethical, alternative health practitioners. If opinions conflict, a medical doctor educated in alternative health approaches may be best qualified to help you choose the best mode of treatment for you. Using self-healing techniques without making careful assessment of your condition can be dangerous and even life-threatening. I've known people who have died from curable illnesses because they would not consider conventional medical treatment. There is no inherent conflict between good medicine and self-care. Properly used, each complements the other. When people seek my opinion about self-healing approaches for their illness, my first goal is to help them assess the risks that they may be taking by postponing medical treatment. Now, I talk with their family doctor and appropriate specialist to determine whether they can safely explore alternatives for a 6-week to a 3-month period. I ask the other doctors to monitor their progress during this time. In most cases, the doctors are very happy to cooperate. In some cases, the risk of delaying treatment precludes a safe trial of self-healing, and a medical or surgical intervention is necessary. Even then, self-healing techniques may help any treatment work even more effectively and can help speed the healing and minimize adverse effects of treatment. A second precaution applies if your symptoms or illness can be triggered by stress or emotional reactions. If this is the case, you may bring on symptoms when you begin working with imagery. Yet, if this happens, you should feel encouraged, because if imagery can provoke your symptoms, it can almost always be used to relieve them. And if you have potentially dangerous symptoms, however, like angina, heart pains, or asthma, Be sure to have medications at hand that can reliably alleviate them. If your condition is really unstable and potentially dangerous, you might consider working first with a professional who can both guide you in your imagery and attend to appropriate medical precautions. The Academy for Guided Imagery, the resource guide is included, can refer you to a qualified health professional. Most of the time, however, symptoms pose no immediate danger. If you're not neglecting your good medical care, you can safely experiment with the imagery to see how effective that you can be in healing yourself. With thoughtful use, imagery is a safe, inexpensive, and often effective addition to your healing effort. And the only experiment that will tell you if it will help you is the one you do yourself. The skills I'll teach you are those I've seen work most consistently in my general medical practice since 1972. In the pages that follow, you will meet some of the people, and their identities have been disguised. I have been privileged to know who have used these methods to recover from their illnesses, and others who've built rich lives in spite of illness. Their healing experiences are often physical, usually emotional, and always attitudinal, and frequently spiritual. I hope their successes will inspire you to explore your own self-healing capacities. Although there are many good books available that mention or teach imagery skills for self-care, which are listed in the Appendix B, they tend to focus either on the theoretical or research aspects of imagery, or on its use in particular symptoms or illnesses. In my practice and my workshops, I'm often asked for a clear, simple guidebook to using the imagery for self-healing across the broad spectrum of common health problems. Now, this book is my attempt to provide just that, and I hope you will find it helpful. Chapter 1: Faith, Healing, Placebo Effects, and Imagery. When I was in my second year of practice working in the country medical clinic, a middle-aged woman named Edna came in for a checkup. She was a likable, talkable person who said she had come because the doctors worry me so and tell me I better keep an eye on my blood pressure. Her chart revealed that she'd been diagnosed with a precancerous condition of the uterine cervix more than 2 years earlier, and the gynecologist wanted to take biopsies and remove the affected areas. Edna had turned this recommendation down 4 times. Each successive note put in her chart by her gynecologist consultant sounded more and more frustrated and concerned, and there was mention of possible psychopathology and irrational beliefs about healing. When I asked Edna why she was unnecessarily risking her life, she smiled broadly at me and told me that Jesus will heal me and I don't need surgery. Well, she said she prayed and talked to Jesus every day, and he promised that he would heal her if she'd put her trust in him. Now, I asked her how she communicated with Jesus, and she told me I see him when I pray, and he talks to me just like we're talking now. I again explained the medical concern that I and the other doctors shared about her. Then I told her I had no doubt that Jesus could heal her if he wanted to, but that I wondered how long it would take, and she was a bit surprised when I asked her if she would be willing to get in touch with him and ask him if he'd agree to heal her in the next 6 weeks. She closed her eyes and after a few minutes smiled and nodded her head. Yes, he says he can and will heal me in 6 weeks. Well, she agreed to have another pelvic exam and pap smear at the end of 6 weeks. She also agreed to have a cone biopsy performed if the pap smear was still abnormal. But it won't be, she said. I know that now. And she left smiling more widely than ever. I was glad to have obtained a commitment from her to have a biopsy if her prayer proved ineffective. 6 weeks later she returned. Her cervix looked normal on examination. 3 days later, her pap smear report came back perfectly normal. Now, Edna's story certainly does not mean that you can forego pap smears or that you must believe in Jesus. It does, however, point to the potent healing effects of faith and belief. The power of positive, expectant faith. Like most physicians, I had, of course, witnessed the placebo effect on many occasions. It wasn't uncommon at the county hospital to give water injections to overly dramatic patients complaining of pain, while telling them it was a powerful pain medication. While a shot of placebo solution relieved pain as effectively as if it had been morphine, at the time we thought that this kind of response to placebos could tell us if the pain was real or not. As you'll see, the issue is not that simple. I had also noticed with interest how many people began to feel better the instant they took the first dose of a medication known to take hours, days, or even weeks to begin working pharmacologically. Not to mention how many times people began to feel better as soon as I wrote their prescription. And no one knows exactly how these effects come about, but they are everyday occurrences in medicine. It's been determined that the placebo effect is responsible for over half the action of some of our most powerful and trusted drugs, and much of the action of any therapy, alternative or conventional, medical, surgical, or psychological. Belief can not only draw positive reactions from neutral substances, it can even cause people to react in opposition to the pharmacologic effects of a medication. A physician reported giving syrup of Ipecac to 2 patients with severe nausea and vomiting. Now, Ipecac is a very powerful emetic. It makes you vomit, and it's usually given to people who have swallowed poison in an effect to clear their stomach. Now, in this case, the patients were told that the Ipecac was a very strong medicine that would soothe their stomach and stop their vomiting. And it did. Now, the power of expectation and faith affects even surgical outcomes. In the 1950s, there was a good deal of enthusiasm in the medical community about an operation that was quite successful in relieving chest pain, angina pectoris, and improving heart function in men with blockages in their coronary arteries. Now, the operation involved making an incision next to the breastbone, taking off a relatively superficial artery, which theoretically shunted more blood to the arteries supplying the heart. Many of the patients who underwent this procedure improved dramatically, experiencing both relief of pain and an improvement of heart function. Then a controlled study was done on the operation. A matched group of men with similar angina were brought to the operating room. They were anesthetized and a surgical incision was made. Half of these men, however, were sewn up again without having anything else done to them. After surgery, they experienced the same dramatic relief of angina pain and enjoyed the same improvement in heart muscle function as the men who underwent the actual operation. To call an effect placebo does not mean that the patient's response to the placebo isn't real. It simply means that the response stems from the patient's belief in the therapy rather than from the therapy itself. What is important about the placebo response is that it demonstrates beyond a doubt that thoughts can trigger the body's self-healing abilities. Somehow, under certain conditions, our intentions, desires, and beliefs in recovery are translated into physical healing. What are the conditions that allow this to happen? If we can be tricked into healing, why couldn't we heal on purpose? How can we best use our minds and wills to further the process of healing? And what are the best thoughts for healing? These questions have motivated me ever since I first worked with Edna, and ultimately led to my involvement with imagery. My introduction to imagery. In 1972, I visited a doctor friend of mine who was working in an experimental health clinic in the seaside town of Bolinas, California. The founder and director of the clinic was a physician named Irving Oyl, who had retired to Bolinas from his general practice in New York. Dr. Oyl, who left his life in 1994, had at the time combined his interest in physics, parapsychology, psychology, and medicine into an informal clinical study of alternative healing methods. He was a masterful clinician who almost seemed able to talk his patients into getting well. Instead of routinely prescribing medicines, Dr. Oyl would have the patients relax and visualize themselves healing. He would have them imagine having a conversation with a wise figure who could tell them why they were sick and what they could do to get better. At that time, I was studying and beginning to practice acupuncture in a neighboring town. Dr. Oyl was also researching acupuncture, and I began to visit the clinic frequently to compare notes. During my visits, I became fascinated with the self-awareness and clinical improvement people seemed to be experiencing from working with his imagery techniques. My interest in imagery remained rather superficial at this time. However, until later that year, when I heard a radiation oncologist, Dr. Carl Simonton, and his wife, Stephanie Matthews Simonton, a psychologist, present several cases of patients with untreatable cancers who seem to have recovered with the use of a simple visualization technique. Now, this technique consisted of relaxing and picturing their immune cells as numerous, aggressive, and powerful, destroying the cancer cells, which they visualized as isolated, weak, and confused. The Simontons reported that people imagined the battle in many different ways, from knights on horseback routing their enemies to vicious dogs gobbling up chunks of meat. The atomic accuracy of the image did not seem to matter as much as the enthusiasm and frequency of the practice. The Simontons have since gone on, and together, independently, to expand their method into a comprehensive psychological program for dealing with cancer. But their initial work with imagery stirred a great deal of public and professional interest in the healing power of imagery. Now, it certainly stimulated mine. I began to work closely with Dr. Oyl for the next 3 years, seeing patients with him and immersing myself in the explosion of theoretical, experimental, and clinical information about the mental effects on healing that surfaced in the early to mid-1970s. I had already studied Eastern psychologies and had learned several forms of meditation while in school. Now, I was studying Jungian psychology, hypnosis, Gestalt therapy, neuro-linguistic programming, and psychosynthesis. I took various courses, including the Silva mind control and mind dynamics, and I learned about quantum physics, holography, and solipsism. I became more knowledgeable in fields ranging from neuropsychology to parapsychology, and found useful information about healing in all these sources. I also paid careful attention to the research that was emerging from the laboratories of people like Neil Miller at Rockefeller University, Herbert Benson at Harvard, and Elmer and Alice Green at the Menninger Foundation. They and many others began to put scientific ground under the profuse flowering of psychophysiological healing approaches. My association with Dr. Oyl enabled me to meet many of the important pioneers of holistic medicine and to exchange experiences and ideas with them. They all shared a great deal of enthusiasm about the human potential for self-healing and imagery. and seem to play an important and often central role in their methods. Most significantly, I watched my patients who were willing to try these new methods, and many of which are actually thousands of years old. And I saw how pleased they were to be able to relax, to relieve pain, and to learn from their illnesses and do something to help themselves. I was surprised almost daily at the kinds of problems that responded to imagery of one sort or another. Nearly 30 years later, I'm still frequently surprised. Science and the practice of healing. Literally thousands of scientific studies have demonstrated the attitudinal, emotional, and behavioral effects on psychology, physiology, and healing. Since I first became interested in this area, there remains nevertheless, especially in the medical community, resistance to the idea that people can do anything to influence their own healing. These skeptics claim that many of the methods that I'll teach you have not been scientifically proven, and they're right. In considering their role in healing, however, we need to take a closer look at the relationship between scientific proof and the clinical practice of medicine. Now, the instruction of medicine bases much of its authority on the claim that it is a scientific discipline, and it rightly looks for scientific proof underlying those claims of therapeutic effectiveness. While this is a noble goal, the fact is, the day-to-day practice of medicine includes very little that is scientifically well proven, and a good deal of what is not proven. The gold standard of scientific proof is the double-blind, randomized, controlled study. In such a study, neither patients receiving treatments nor the doctors administering the treatments know what the patient's getting, and the outcome is assessed by independent analysis who don't know whether the patients receive the real or placebo treatments. Now, these extreme measures to maintain secrecy are taken in order to separate the always present placebo effect from the effect of the treatment being tested. Now, while double-blind studies are the most definitive, very few clinical studies are of this design. In fact, as recently as 1976, fewer than 5% of original research articles published in the New England Journal of Medicine, as well as the Journal of the American Medical Association and the Lancet, fewer than 5% were based on controlled matched studies of any kind. Only a fraction of that small percentage were double-blind studies. Now, if doctors were to limit themselves to using only treatments that have been conclusively proven worthwhile through double-blind studies, they would prescribe very little treatment at all. Yet, because our patients are suffering, we must often use our best judgment in suggesting other less rigorously proven treatments. And ideally, we choose from remedies that have a long history of effectiveness and safety in clinical experience, or, if no such option is available, from newer methods whose potential benefits outweigh their potential risks by a large enough margin. This conflict between necessary and certainty in treatment is so fundamental to medical practice that it's addressed on page 1 of Harrison's textbook of internal medicine, one of the most widely used medical textbooks in print. And here's what Harrison says. In the practice of medicine, the physician employs a discipline which seeks to utilize scientific methods and principles in the solution of its problems, but is one which, in the end, remains an art, in the sense that the practicing physician can never be content with the sole aim of clarifying the laws of nature. He cannot proceed in his labors with the cool detachment of a scientist whose aim is the winning of truth, and who theoretically is uninterested in the practical outcome of his work. The practicing physician must never forget that his primary and traditional objectives are utilitarian, the prevention and cure of disease, and the relief of suffering, whether of body or mind. Now, faced with illness, distress, and uncertainty, the informed patient and the practicing physician must often consider options that may not be rigorously proven, as they attempt to formulate a sensible plan for treatment and self-care. Even simple clinical research on human beings is difficult because of the many influences on the outcome that cannot be controlled. Now add this the difficulty of trying to determine what an individual is really thinking, and we're faced with the very real possibility that it may never be possible to conclusively prove or disprove this theory that thoughts can ameliorate or cure disease. Another factor that makes imagery practically difficult to quantify scientifically is that it often influences healing in ways that might best be termed non-linear. Healing may not be a simple matter of imagining a problem disappearing and having it disappear. Imagery may help a patient become aware of how his or her symptoms develop and lead to changes in their attitude or behavior that will then lead to recovery. Let me share an illustrative case with you from my practice. Alexandra was 30 years old, active and successful, but worried, and she developed a number of lumps in her breast. Several physicians had diagnosed them as benign nodules, but she worried that they were precancerous and wanted to know if she could do anything to make them go away. Alexandra was intensely involved in every aspect of her life, and she worked long hours, traveled frequently in her work. She kept a busy social schedule as well. She often felt tense and tired, and she wanted less stress in her life, though she saw that stress was a problem separate from her breast lumps. As part of our consultation, I asked her to relax and let an image of the lumps come to mind. She imagined them as rocks in a stream and was upset to see that they were partially obstructing its flow. As she looked more closely, however, her perception of the rocks changed dramatically. She noticed that they were very smooth, shiny, and lustrous, and looked more like pearls than rocks. Now, Alexandra immediately understood that, like pearls in an oyster, these lumps had formed in response to irritation and represented an attempt to protect her from further harm. When I asked her what would need to happen for the pearls to dissolve, she sensed a need to remove the source of the irritation. She consequently made changes in her scheduling, her traveling, and her diet, and the lumps in her breast disappeared within a few months. By paying attention to her problem in this way, Alexandra not only learned a valuable lesson in stress management, she also personally experienced the wisdom of her body and mind working together to maintain a healthy equilibrium. Her symptoms got her attention, and her imagery allowed her to understand both the meaning of her symptoms and what she needed to do to allow healing to proceed. Now, in her case, the imagery did not dissolve her lumps directly, but showed her what she could do to allow this to happen. Now, how would you quantify the effects that imagery had on Alexandra's recovery? Well, for science, that's the crucial question, and a difficult one indeed. Fortunately, you don't need to wait until this issue is decided scientifically to see whether or not this approach will be helpful to you. As long as you heed the precautions I described in the preface, imagery is quite safe, and it offers potential benefits that far outweigh its risk. You are your own research laboratory and granting authority for experimenting with self-healing, and you have the need, the opportunity, and the right to explore this method for yourself. You would have to do this in any case, since no treatment works for everyone. Even if these techniques had been irrefutably proven to work in 90% of the time, you'd still have to find out if they work for you. Now, in the next chapters to come, you, like Alexander, will learn to use your imagination to better understand your health and to influence it for the better. In the next chapter, we'll take a closer look at the nature of imagery, its known effects on psychology, physiology, and the possible mechanism of its ability to affect body and mind. Chapter 2. How does imagery work? What exactly is imagery? Essentially, it is a flow of thoughts that you can see, hear, feel, smell, or taste. An image is an inner representation of your experience or your fantasies, a way your mind codes, stores, and expresses information. Imagery is the currency of dreams and daydreams, memories and reminiscence, plans, projections, and possibilities. It is the language of the arts, the emotions, and most important, of our deeper self. Imagery is a window to your inner world, a way of viewing your ideas, feelings, and interpretations. But it is more than just a window. It is a means of transformation and liberation from unconscious distortions that may be directing your life and shaping your health. Imagination, in this sense, is not sufficiently valued in our culture. The imaginary is equated with the fanciful, the unreal, and the impractical. In school, we're taught the 3 R's, while creativity, uniqueness, and interpersonal skills are either barely tolerated or frankly discouraged. As adults, we are usually paid to perform tasks, not to think creatively, and our society puts a premium on the practical, the useful, and the real, while these things also have value. It is imagination that nurtures human reality, just as a river brings life to a desert. And without imagination, humanity would have become extinct long ago. It took imagination, the ability to conceive of new possibilities, to discover fire, to create weapons and cultivate crops, or construct buildings and invent cars and airplanes and space shuttles, television and computers. Paradoxically, our collective imagination, which has allowed us to overcome so many natural threats, has also been instrumental in creating the major survival problems we face on the earth today: pollution, exhaustion of natural resources, and the threat of nuclear annihilation. Yet imagination teamed with will remains our hope for overcoming these same problems. Imagery and psychological change. Imagery in healing is probably best known for its direct effects on physiology. Through imagery, you can stimulate changes in many bodily functions usually considered inaccessible to conscious influence. Here's a simple example. Touch your finger to your nose. How did you do that? You may be surprised to learn that nobody really knows. A neuroanatomist can tell us the area of the brain where the first nerve impulses fire to begin that movement. Now, we can also trace the chain of nerves that conduct impulses from the brain to the appropriate muscles. But no one knows how you go from thinking about touching your nose to firing the first cell in the chain. You just decide to do it, and you do it, without even having to know how. Now make yourself salivate. You probably didn't find that as easy, and you may not have been able to do it at all. That's because salivation is not usually under our conscious control. It's controlled by a different part of the nervous system than the one that governs movement. Now, while the central nervous system governs voluntary movement, The autonomic nervous system regulates salivation and other physiological functions that normally operate without our conscious control. Now, the autonomic nervous system doesn't readily respond to ordinary thoughts like salivate, but it does respond to imagery. Relax for a moment. Imagine you're holding a juicy yellow lemon. Feel its coolness, the texture, and the weight in your hand. Imagine cutting it half and squeezing the juice of one half of it into a glass. Perhaps some pulp and a seed or two drop into the glass. Imagine raising the glass to your lips, taking a good mouthful of that sour lemon juice. Now swish it around in your mouth. Taste its sourness and swallow. Now, did you salivate? Did you pucker your lips or make a sour face? If you did, that's because your autonomic nervous system responded to the imagery of the lemon juice. You probably didn't spend much time thinking about drinking the lemon juice, but through a similar mechanism, what you do habitually think about may have significant effects on your body. If your mind is full of thoughts of danger, your nervous system will prepare you to meet that danger by initiating a stress response, a high level of arousal and attention. If you imagine peaceful, relaxing scenes instead, it sends out an all-clear signal, and your body relaxes. Research in biofeedback, hypnosis, and meditative states has demonstrated a remarkable range of human self-regulatory capacities. Using focused imagery in a relaxed state of mind seems to be the common factor among these approaches. Imagery of various types has been shown to affect heart rate, blood pressure, respiratory patterns, oxygen consumption, carbon dioxide elimination, brainwave rhythms and patterns, electrical characteristics of the skin, local blood flow and temperature, gastrointestinal motility and secretions, sexual arousal, levels of various hormones and neurotransmitters in the blood, and immune system function. This tells us that imagery can affect the major control systems of the body, but the healing potential of imagery go far beyond its simple effects on physiology. Imagery in the larger context of healing. Recovering from a serious or chronic illness may well demand more from you than simple imagery techniques. It may also require changes in your lifestyle, your attitudes, relationships, or emotional state. Imagery can be an effective tool for helping you see what changes need to be made and how you can go about making them. Imagery is the interface between what we call body and what we call mind. It can help you to understand what needs may be represented by an illness and to develop healthy ways to meet those needs. Now let me give you another example from my practice. Jeffrey was a successful middle manager in his 30s who had recurrent peptic ulcers for many years. In our work together, he learned to relax and use simple visualization to give himself temporary relief from his stomach pain. He pictured the pain as a fire in his stomach and would even imagine an ice-cold mountain stream extinguishing the fire and cooling the scorched area beneath it. He was surprised and pleased to find that relaxing and imagining this process for a few minutes would relieve his pain for several hours to days at a time. And he used it successfully for about 2 weeks. Then this method stopped working, and his pain grew worse in spite of his visualizations. He began to despair. In our next session, I suggested that he focus once more on the pain and allow an image to arise that might help him understand why the pain had returned. He soon became aware of an image of a hand pinching the inside of his stomach. At my suggestion, he mentally asked the hand if it would tell him why it was pinching him, and it changed into an arm shaking a clenched fist. He asked the arm why it was angry, and it replied, "Because there's a part of you locked away where no one can see it, and it's getting badly hurt." I asked him to form an image of the part that was locked away, and he saw a transparent sack that contained a chaotic whirling of things inside. Nothing is clear. Everything is zooming around, bumping into everything else. All he could make out were colors, shapes, and a sense of discomfort. After observing the sack for a while, he quietly said, "My heart's in there. It's getting bumped and bruised by all these things." I asked Jeffrey to imagine opening the sack, but as he began, he became afraid, and he said there was too much pain there to let it all out at once. So I asked him to let just one thing out of the bag and to let an image form for it. He imagined his father's face and recalled a number of painful childhood interactions with his father, who was quite emotionally abusive. Over a series of sessions, Jeffrey began coming to terms with the feelings he had locked away about the abuse that he had suffered, and started to feel much better emotionally and physically. By using imagery, he not only obtained relief from his ulcer pain, but he also learned to better express and respond to his own emotional needs. Using imagery in this way can allow illness to become a teacher of wellness. Symptoms and illness indicate that something is out of balance. That something needs to be adjusted, adapted to, or changed. Imagery can allow you to understand more about your illness and to respond to its message in the healthiest imaginable way. How does imagery work? Well, the ultimate mechanisms of imagery are still a mystery. In the last 20 years, however, we have learned that imagery is a natural language of a part of our nervous system. Critical to this understanding is the Nobel Prize-winning work of Dr. Roger Sperry and his collaborators at the University of Chicago, later also at the California Institute of Technology. They have shown that the two sides of the human brain think in very different ways and are simultaneously capable of independent thought. In a real sense, we have two brains. One thinks as we are accustomed to thinking with words and logic. The other, however, thinks in terms of images and feelings. In most people, the left brain is primarily responsible for speaking, writing, and understanding language. And it thinks logically, analytically. It identifies itself by the same name of the person to whom it belongs. The right brain, in contrast, thinks in pictures and sounds and spatial relationships and feelings, and it is relatively silent, though highly intelligent. The left brain analyzes, taking things apart, while the right brain synthesizes and puts things together. The left brain is better at logical thinking, while the right is more attuned to emotions. The left is most concerned with the outer world of culture and agreements and business and time, while the right is more concerned with the inner world of perception, physiology, form, and emotion. The essential difference between the two brains is in the way each processes information. The left brain processes information sequentially, while the right brain processes it simultaneously. Imagine a train coming around a curve in the track. An observer is positioned on the ground on the outside of the curve, and he observes the train as a succession of separate though connected cars passing him one at a time. He can see just a little bit of the cars ahead of him and behind the one he is watching. The observer has a left brain view of the terrain. Now, the right brain observer would be in a ball balloon several hundred feet above the tracks. And from here, she could not only see the whole train, but also the track on which it was traveling, the countryside through which it's passing, the town it had just left, and the town to which it was headed. Now, this ability of the right hemisphere to grasp the larger context of events is one of the specialized functions that make it invaluable to us in healing. The imagery it produces often lets you see the big picture and experience the way an illness is related to events and feelings you might not have considered important. It allows you to see not only the single piece, but also the way it's connected to the whole. A right brain perspective may allow you to put pieces together in new ways to produce new solutions to old problems, to see the opportunity hidden in an illness or a problem. Now, the right brain has a special relationship not only to imagery, but to emotions. Another of the major strengths it brings to the healing adventure. Many studies have shown that the right brain is specialized in perceiving emotion, in facial expression, body language, speech, and even music. And this is critical to healing, because emotions are not only psychological, but physical states are at the root of a great deal of illness and disease. Rudolf Virchow, a 19th century physician and founding father of the science of pathology, remarked that much illness is unhappiness sailing under a physiologic flag. Studies in England and the United States have found that from 50 to 75% of all problems that patients bring to their primary clinic are emotional, social, or familial in origin, though they are being expressed through pain or illness. Emotions themselves are, of course, not unhealthy. On the contrary, they are a normal response to certain life events. Failure to acknowledge and express important emotions, however, is an important factor in illness, and one that is widespread in our society. As a result of how our culture shapes us, we are in many ways emotional illiterates. Lacking clear guidelines and traditions for expressing emotions in a healthy way, it's difficult to know how to respond to distressing emotions such as grief and fear and anger, so we cope the best we can. We may unconsciously build layer upon layer of inner defenses to protect us from feeling these unpleasant emotions. But strong emotion has a way of finding roots of expression. If not recognized and dealt with for what it is, it may manifest as pain or illness. Social and family relationships, to some extent, will depend on our ability to process emotions internally. We don't need to express every emotion we feel, but strong, persistent emotions need to be expressed or resolved, since chronic denial of them may lead to psychological imbalance and disease. Alice's story is one example of how holding back feelings can manifest as pain and how expressing them appropriately can lead to relief. Alice was in her 40s and had recently undergone surgery and radiation to treat a breast cancer that had been discovered several months earlier. She was an intelligent, composed woman who felt that imagery and visualization had already been enormously beneficial to her in tolerating her treatment and recovering from her cancer. She continued, however, to be bothered by persistent pain between her shoulder blades. Repeated examinations and x-rays taken by her cancer specialist had failed to identify any physical cause of her pain. She wanted to understand why it was there and what she needed to do for it to go away. We decided to use imagery technique that you will later learn in this book A talk with an imaginary wisdom figure called an inner advisor. Alice relaxed and imagined herself on a beautiful beach at the base of a high cliff. She asked for an image of her inner advisor and saw a man who looked like Merlin the magician. He was tending a fire, and after greeting him, she asked him about her back pain. After a few seconds of silence, she broke into tears, and she told me her advisor said she needed to ask for help. And that's what had brought on the tears. She had been strong and courageous throughout her illness, and calming and reassuring to her husband and family. She always went for checkups and treatments alone, though it frightened her because she felt her husband and kids would be uncomfortable if she asked them for help or company. She had tried to protect her loved ones by not expressing her own doubts, fears, and concerns about her illness and its treatments. Alice told her inner advisor her concerns about scaring her family if she asked them for help, and her advisor answered, "They are already scared, and they will feel better if they're included in your trials and have an opportunity to be supportive and show their love for you." She realized immediately that this was true. She imagined asking her husband John for help. She laughed as in her mind's eye she saw him taking out his appointment book and thumbing through it. She asked him, still on Imagery, "Do you have time?" And he looked at her over his half-rimmed glasses and said, "We'll make time." And when she came out of the Imagery, her pain was substantially relieved, and with just enough left to remind me that I actually need to talk with John about this in real life. Like Alice, we may all hold back emotions because of conflicts between our thoughts and feelings. And while she thought it would be better to keep her feelings to herself, expressing the emotions to her loved ones helped her, and them as well. This inner conflict has been recognized in the oldest stories of humanity, beginning with the story of Adam and Eve. That it may, on one level, represent a disagreement between the two hemispheres of the brain is a new, potentially helpful way to understand this situation. As Dr. Joseph Bogan of the California Institute of Technology, the neurosurgeon who helped reveal the dual nature of the hemispheres, he said having two brains has allowed man to be the most creative animal on earth, since we have two chances to solve any given problem. At the same time, it creates an unprecedented opportunity for inner conflict. Now, when we experience an inner conflict, our body becomes the battleground, and it may pay dearly for prolonged, serious struggle. Bringing the conflicting sides to the bargaining table may be the beginning of healing. Now, the goal, after all, is not to become a left-brained or a right-brained person, but a whole-brain person. In any successful arbitration, both sides must have the opportunity to express themselves and to state their grievances, their desires and needs, and what they can offer in the interest of peace. If they speak different languages, there must be an impartial translator willing to learn and speak for both sides, or the two must attempt to learn each other's language. This is why learning about imagery is important. It is the dominant language of the right brain and the human unconscious. Most of us understand and use left brain language and logic every day, and we're relatively familiar with our conscious needs and desires. Imagery gives the silent right brain a chance to bring its needs to light and to contribute its special qualities to the healing process. Frankly, calling verbal or logical thinking left-brained and symbolic and imagery thinking right-brained is an oversimplification. But it's a useful model for discussing some types of imagery. This imagery allows you to communicate with your own silent mind in its native tongue. It is a rich, symbolic, and highly personal language, and the more you observe and interact with your own image-making brain, the more quickly and effectively you will use it to improve your health. If you're ill, you have undoubtedly thought long and hard about why you fell ill in the first place and what you need to do to get better. If your illness is chronic or severe, you have probably consulted many doctors whose highly educated logical analysis may have led to a diagnosis, yet the diagnosis may not have led to a cure or even relief. If good left brain thinking has come to naught, why not get a second opinion from your right brain? After all, who's likely to know more about your body, your feelings, and your life? What kinds of illnesses can be treated with imagery? While preliminary studies have determined that imagery can be an effective part of treatment in a wide variety of illnesses, I'm reluctant to offer a list of diseases that could be treated with imagery. Imagery can be helpful in so many ways that it is more accurate to think of it as a way of treating people than a way of treating illnesses. Imagery can help you whether you have simple tension headaches or a life-threatening disease. Through imagery, you can learn to relax and be more comfortable in any situation. Whether you are ill or well, you may be able to reduce, modify, or eliminate pain or other symptoms. You can increase or decrease blood flow, muscle tension, or modulate your immune system response. You can use imagery to help determine if your lifestyle or habits have contributed to your illness and to see what changes you can make to support your recovery. Imagery can help you tap inner strength and find hope, courage, patience, perseverance, love, and other qualities that can help you cope with, transcend, or recover from almost any illness. There are, of course, certain symptoms and illnesses that seem to be more readily responsive to imagery than others. Conditions that are caused by or aggravated by stress often respond very well to imagery techniques. Now, these include such common problems as headaches, neck pain, back pain, nervous stomach, spastic colon, allergies, heart palpitations, dizziness, fatigue, and anxiety. Other major health problems, including heart disease, cancer, arthritis, and neurological illnesses, are often complicated by or themselves cause stress, anxiety, and depression. Now, the emotional aspect of any illness can often be helped through imagery, and relieving the emotional distress may in turn encourage physical healing. I must repeat that good medical care for the serious problems mentioned above is essential and perfectly compatible with imagery. If you choose to have therapeutic treatments of any kind, acknowledge them as your allies in healing and include them in your imagery. If you are taking an antibiotic or chemotherapy, imagine the medicines coursing through your tissues, finding and eliminating the bacteria or tumor cells you are fighting. If you have surgery, imagine the operation going smoothly and successfully, and your recovery being rapid and complete. In fact, there is good evidence that this type of pre-operation preparation reduces recovery time and complications from surgery. And now that you've considered what imagery can do, how might it work? Let's begin your personal exploration of the process. Chapter 3. A first imagery exploration. As a first step in working with imagery, I'd like to suggest that you begin with a journal or notebook in which to record monitor your experiences and progress. Consider this journal a diary of your personal experience with healing. Record your imagery experiences, include your thoughts, feelings, questions, and changes in health status as you go. Use it to keep a record of your moods, your stress level, symptoms, diet, and activity level. Write in it, draw in it, paste newspaper articles or magazine pictures in it, and include anything else that has meaning for you in your healing work. And this is your record. Keep in it any form that will be most useful to you. You'll find this journal valuable in many ways as you become more aware of the many factors that influence your healing. Reviewing your journal from time to time will help you see the process as it unfolds, remind you of lessons already learned, and help you spot recurring patterns that may deserve more exploration. Now let us begin to explore imagery. One of the most common misunderstandings about using imagery is that you must be able to visualize to do it. While imagery certainly includes what you see mentally, it also consists of what you hear in your inner ear, sensations and emotions that you feel inside, and even what you smell and taste in your imagination. Some people imagine a vivid visual image with color, sound, smell, and sensation, while others may experience sounds, songs, or thoughts in their head without any pictures. Some will be more aware of senses or feelings that guide them and let them know when they are close to something meaningful. And it doesn't really matter how you imagine, just that you learn to recognize and work with your own imagery. Your purpose is not to get pretty pictures, but to pay attention to what your body and mind is trying to tell you. Imagery is a vehicle to this understanding, which may come through inner pictures, words, thoughts, sensations, or feelings. A simple script follows that will allow you to explore imagery with your different senses, to experience how you use imagery most naturally. As you go through this script, notice the different ways that you imagine and which ways are easiest for you. There are no right or wrong images to have, and your task is merely to focus on what is being suggested and notice what images develop for you. Be an observer as well as a participant in the process. How to use the imagery scripts. There are a number of ways to use the scripts in this book. You may want to read through each exercise slowly, either mentally or aloud, pausing after each suggestion to experience your imagery. Now this first script is designed to be used that way, but the scripts in the following chapters work much better if they are read to you or tape recorded and played back, allowing you to close your eyes, focus more easily inside, and immerse yourself in your inner experience. You can tape record the scripts yourself, speaking in a relaxed voice and pausing where indicated by quotation marks, and leaving enough time after each suggestion for the inner experience to unfold. If you have difficulty recording, or if you don't find your own voice soothing, you may have a friend with a calming manner and voice who will read or record the scripts for you. If you record your own tapes, do a sound check early in the recording process. Record a few lines of the script, then stop and replay the tape to check for recording quality. It's frustrating to record a 25-minute tape and find you were too far away from the microphone and that the pause button was on, or that the noise from an inexpensive recorder has drowned out your voice. Once you have acceptable sound quality, take a couple of deep breaths, relax, and begin to record. You can also order the audio tapes I have recorded of all the scripts in this book. See page 259 for ordering information. Now these studio recorded tapes usually have better sound quality than you can produce at home, and the phrasing, pacing, and voice modulation on them is the result of many years of practice and research. However you decide to use the scripts, begin by selecting a quiet, private location where you won't be interrupted for about 20 to 30 minutes. Tell anyone who needs to know not to disturb you during this time except for a true emergency. Take the phone off the hook and turn off the answering machine. Loosen any tight or restrictive clothing or jewelry. Get in a comfortable position, either lying down or sitting, and remember that you can move or shift positions anytime to become even more comfortable. The script: exploring your imagery abilities. Begin by getting comfortable where you are. Let yourself breathe easily and comfortably. Take a couple of slow, deep breaths and let out the breath. Let the out breath be a real letting go kind of breath. Just begin to let go of any unnecessary tension or discomfort. As you relax, allow your eyes to close and begin to focus inside. As I ask you to imagine a variety of things, allow yourself to observe what happens for you. Remember, there is no right or wrong way to imagine these things. Just notice what it's like for you. That's your only responsibility now. Notice what it's like. Imagine a triangle. Any type of triangle will do. You may imagine you see it on a screen, like a movie or television screen. Or you may imagine it in your mind. Just notice which is easier for you. Notice what type of triangle you see. Perhaps there is more than one. Notice if the image is steady or vivid, or if it comes and goes, or changes as you watch it. Remember, it doesn't really matter how you imagine it. Just stay relaxed and observe what is happening. If you'd like the image to be clearer or more vivid, imagine you have a set of controls like you do on your TV set and experiment with them until the image is the way you want it. Or just take a couple of deep breaths and relax more deeply as you let them go, letting the image become clearer as you do. And notice how these techniques work for you. Now let the image go. Let a square form in your mind's eye or on your mental screen. Any kind of square is fine. And just notice what it's like as you continue to observe it. Now let that image fade and imagine a circle now. Notice how big or how small it is, and just how round. Let the circle be yellow, a bright yellow circle. Notice if it helps to think of the sun or a yellow lemon. Now let the yellow fade and imagine the circle is now red, like an apple or something red that's familiar to you. Now let that go and imagine the circle is now blue, like the sky or the ocean. Let the circle become three-dimensional and form a sphere. And let the sphere begin to rotate slowly. See it rotating and let it become a globe spinning in space, as if you were looking back at the Earth from outer space. Now come back to Earth. Imagine you are in the country and it's winter time. You're walking through the freshly fallen snow and can hear and feel it crunch beneath your boots. The air is cold and crisp, and you can see your breath as you exhale. In the distance, a church bell is pealing. Somewhere a radio is playing Jingle Bells. And notice what that sounds like. Now, let that image fade and imagine instead you are on a beautiful, warm, tropical beach. The sky's blue, the sun is bright and warm on your skin. The sand is warm beneath your feet. The ocean is vast and the waves roll to the shore one after the other in a timeless, tireless rhythm. You can hear the sound of the waves breaking, advancing, and retreating on the sand. Imagine that you walk down toward the water, feeling the sand becoming hotter underneath your feet. You may begin to walk a little more quickly as it becomes hotter and hotter as you reach the waterline where the water has washed and cooled the sand, and you feel the relief of the cool wetness on the soles of your feet. As you walk a little way into the cool, swirling water, it washes around your ankles, and as it retreats, it draws away some of the sand beneath your feet. The movement of the sand in the water feels good beneath you. Now let that image go and imagine you are in a room from your childhood. A room where you had some very good experiences. Notice where you are and what you see there. Notice what sounds you hear there. Perhaps an odor or an aroma that's special to that place. Notice how it feels just to be there. Now let that image go and imagine the aroma of fresh ground coffee. Now imagine there's a plate of your favorite food in front of you, beautifully prepared from the freshest ingredients. You lean over and inhale the aroma. Then take it in. Then taste it. Notice what it's like as you taste it, as you chew it and swallow. Now let that go and imagine you're walking along the path in the forest. It's a beautiful day and you meet someone who's friendly on the path. You stop to have a brief conversation with this person. Notice who you meet and what you talk about. Notice how you communicate with one another. If there are any loose ends, or if you want to continue this talk, arrange with the imaginary person to meet again at a later time. Now let that go and recall sometime that you felt very much at peace with yourself. A time when you felt very peaceful, very centered and calm. Imagine it as if it were happening right now, Notice where you are and who you're with, what you're doing. Notice your posture and your face, your voice, and especially notice the feelings of peacefulness and centeredness in you. Notice where you feel these qualities and let them be there. Let them begin to grow in you. Let them amplify and expand, filling your whole body with feelings of peacefulness and calm. Let the feelings overflow your body to fill the space around you so that all of you is bathed in this peacefulness. Now slowly let yourself begin to become aware of the room. Let yourself come awake and alert, bringing back with you any feelings of peacefulness you may have experienced. Remember what was of interest or importance to you and take some time to write about it. Now, evaluating your experience. As you write about your experience, you may want to consider the following questions. Did you experience any of the images as pictures, sounds, smells, or tastes? Feelings. Which images came easily, and which were more difficult? And were there any you weren't able to imagine at all? Were you surprised by any particular images or your reaction to them? Did you experience heat or coolness or any other sensation at that time? If you did, you've already begun to influence your body through your imagery. If not, you may want to experiment with your own images until you can imagine these sensations. Were you able to make your images clearer by adjusting imaginary controls or by relaxing even more? Did anything of special interest or importance happen? Did you have emotional reactions to any of the images? Could you develop a sense of peacefulness in the last part of the exercise? If not, work with that part of the script again until you can recall or imagine yourself feeling peaceful. When you do feel peaceful, you have taken an important step in creating a positive emotional state for yourself by choice. If you were able to notice changes in sensation or mood from this first imagery exploration, that's an indication that your body is particularly responsive to your imagery and that you are an excellent candidate for using imagery to improve your health. If you didn't notice any changes, however, don't despair. Like any skill, imagery takes time to learn, and you may first need to learn to relax your body, quiet your mind in order to notice results. Whether or not you have already noticed changes, learning to relax deeply and reliably will assist your movement toward better health in many ways. The next chapter will teach you a simple method for creating a pleasant state of mental and physical relaxation. Chapter 4. Imagery, Stress, and Relaxation. The most important form of imagery that affects our health is worry. It's our imagination that allows us to react not only to current stressors, but to anticipated dangers and remembered griefs. Uncontrolled imagination gives human beings the unique ability to compress a lifetime of stress into every passing moment. Worry is an excellent example of the psychophysiologic power of imagery. When you worry, you focus on thoughts of danger and disaster, which may or may not come to pass. As you do this, your body becomes tense, aroused, anticipating a threat or challenge. The fight or flight response is activated, initiating a change of physiologic changes that ready you for intense physical activity. Your body's on alert and prepared for the worst. Yet, imagined threats may never materialize, and worse, they may never go away. If you're a habitual worrier, one worry replaces another, and the cycle never ends. You don't release your pent-up energy or take the opportunity to relax, and your system can't rebuild its depleted reserves. Eventually, you become exhausted, stressed out, burned out, sick and tired. The only threats have been the thoughts themselves, and though your responses and the physiologic toll they may have taken have been quite real. If the toll on your body has become too great, you can help yourself by becoming skilled in the use of your imagination. You can learn to become aware of and to change habitual unconscious thought patterns that lead to tension and depression. Doing this takes some work, but it can be done, and imagery is the key. The first imagery skill you need to learn is how to stop using troublesome imagery and to focus on thoughts that allow you to relax. In the chapter, you'll learn specific techniques that will help you do just that. Learning to relax is fundamental to self-healing and a prerequisite for using imagery. Effective relaxation is the first step in focusing and concentrating your mind on the process of healing. In addition, deep psychological relaxation has health benefits of its own. It allows your body to channel its energy into repair and restoration, and provides a respite from habitual patterns of tension. Let me share 2 brief cases from my practice that illustrate the potential benefits of simple relaxation. Ed was a middle-aged man who came to me 10 years ago complaining of recurrent sinus infections, constant hay fever, and severe daily headaches above and behind his eyes. Regular doses of aspirin, decongestants, and antihistamines were of minimal help. Conventional allergy testing showed he was sensitive to many pollens and airborne chemicals. He was much worse on smoggy days when the pollen count was high. Years of allergy shots had helped somewhat, but had lost their effectiveness in the year preceding his visit to me. Ed was a busy, caring person, deeply involved with his family, church, and community. He was interested, informed, and concerned about the world. I noticed right away that Ed's brow was deeply furrowed, and he looked worried. He had come to me to see if acupuncture could help him, and we set up a series of appointments for treatments. We also talked about the possible role of stress in his symptoms. I suggested that he take home a tape of the relaxation technique you will learn later in this chapter and listen to it twice daily. The next week he came in for his first acupuncture treatment and happily reported he was already 90% better. He had been enjoying his relaxation and had noticed a major improvement in his symptoms. After a few acupuncture treatments, he was free of headaches and allergy symptoms. He had continued to use the relaxation tape regularly and in 10 years has had no sinus infection, rare mild headaches, and needs no medications. He comes for an acupuncture treatment every year or 2 if the pollination levels are unusually high and his nose gets stopped up. He feels that learning to relax made a bigger change in his health than anything else he had ever tried. Lita, a pleasant but anxious woman, was in her 30s and had been seeing a urologist for several years for dilation stretching of her urethra. The procedure was uncomfortable and she dreaded it, but it would relieve the difficulty she experienced in urinating for about 6 weeks each time she had the procedure done. She had been examined by 2 specialists and was told that a stricture in her urethra was causing her symptoms and that she would probably always need periodic dilation. Learning to relax as a way to reduce her anxiety about the dilation procedure appealed to Lita, and she hoped that if she were less tense, the procedure would be less painful. although at the time neither of us thought relaxation as a treatment for her primary problem. Since she began a regular relaxation practice more than 10 years ago, she has not had any difficulties urinating and has not needed a single dilation. She might have never needed it if she or her doctors had been educated about stress and relaxation. These two cases are examples of the kind of relief that may potentially occur when you begin to relax and allow the natural healing capacities within you to work. I've often thought that if I, as a physician, were limited to only one therapeutic intervention with which to treat all the people who came to see me, I would choose physiologic relaxation. Relaxation is an antidote to the taxing effects of unrelieved stress, a significant factor in most modern illnesses. Over 3/4 of all people who develop significant physical illnesses have experienced unusually high levels of stress in the year preceding their illness. What is stress? Well, stress and its effects are known to be causative, precipitating, and aggravating factors in illnesses as varied as heart disease, cancer, arthritis, diabetes, hyperthyroidism, gastritis, esophagitis, ulcers, colitis, hay fever, asthma, eczema, and sinusitis, as well as common ailments such as headaches, neck pain, back pain, dizziness, weakness, fatigue, anxiety, susceptibility to colds and viruses, menstrual irregularities, chronic vaginal and reproductive system infections, infertility, impotence, and a host of less well-defined syndromes. Dr. Hans Sey, who coined the term stress in the 1930s, described stress as the rate of wear and tear on the body. This rate is affected by our characteristic way of responding to the natural demands for adaptation and change inherent in life. Sey identified and described a pattern of physiologic response, which he termed General Adaptation Syndrome, GAS for short, more commonly known as the fight-or-flight response. Now, this response is nature's way of preparing us to meet a challenge or threat. A serious threat, such as encountering a predator in the wild or being confronted by a mugger, stimulates a pattern of physiologic reflexes in your body designed to help you survive. Your heart rate and blood pressure increase. Your muscles tense in anticipation of a furious bout of either running or fighting. Your blood is shunted away from your skin and digestive organs into your muscles, and clotting is activated so that you can stop bleeding quickly in case of injury. Your pupils open wide and all of your senses are sharpened to, in extreme cases, your bladder or bowels will empty reflexively. Adrenaline and other stress-related hormones are pumped into your bloodstream to provide you with extra energy, and all these changes have just one purpose: your survival. In the above scenario, the outcome would probably be decided fairly rapidly. Within 20 minutes or so, you have either run or fought for your life, and in doing so have burned up the adrenaline and related stress hormones. Your body would then lapse or collapse into a compensatory period of relaxation, a period of letdown in which it can turn its energy to repair and healing. In day-to-day life, however, the sources of our stress are not usually as well defined as tigers or muggers. The demands, real or imagined, of schedules, deadlines, mortgage payments, children, and relationships merge with the almost constant background threat of pollution, crime, inflation, and even the potential of nuclear annihilation to create a high ambient level of tension in our society. Many of these sources of stress can be neither fought nor fled and require that we use different coping skills for living with them without succumbing to the illness. Unless we interrupt the tension states that arise in response to these insidious stressors, we can easily find ourselves living in a continual state of physiologic alarm, literally stewing in our own stress hormones. Dr. Sile describes the stress syndrome occurring in 3 phases: the immediate state of alarm, the phase of resistance to the stress, and finally a stage of exhaustion. During the first 2 stages, you become aware of and grapple with the stress. If the struggle persists for too long, however, exhaustion ensues. You are no longer able to maintain this high level of resistance, and systems begin to break down. In this stage, you become increasingly vulnerable to illness. Stress management is an important aspect of modern life and consists basically of 2 complementary strategies. 1. Changing what can be changed externally to reduce the sources of stress. And 2. Changing your attitude and physiologic responses to those things that can't be changed. One important means of reducing the taxing effects of stress on your system is learning and using an effective relaxation technique. Physiological relaxation, in many ways, the opposite of the fight or flight response to stress. It allows your body to replenish, repair, and restore itself efficiently during periods of inactivity. Regular relaxation interrupts the energy drain of chronic stress. It helps you conserve and build energy that your body can use for healing. An energy model of stress. If I had the pleasure of practicing in Sausalito, California, with a physician and master acupuncturist named Hal Balin, who has since passed away, Dr. Balin developed an extremely useful model for stress management based on the precepts of traditional Chinese medicine. The one law of Chinese medicine states, there is only energy, and the laws it obeys. This law, forming the basis of a medical tradition that is at least 10,000 years old, is fully congruent with our current understanding of the physical universe. Physicists since Albert Einstein have discovered the physical world, which includes our bodies, as complex, interweaving organization of energy that is in changing states of relationship and transformation. Life, at its most basic physical level, is a process of energy exchange. Life as energy is not a metaphysical concept. Rather, it reflects our current state of scientific knowledge. Nonetheless, life energy, or qi as it is called in Chinese medicine, is essentially a mystery. We know neither its origins nor its purpose except according to personal faith. It seems qualitatively different from any other form of energy known and is particularly characterized by its ability to create increasingly complex organizations of matter and energy. The Chinese tradition states that we are all born with an energy inheritance, which is called our ancestral energy. This ancestral constitutional energy is finite and cannot be increased. When it is depleted, we die. This initial deposit of life energy is supplemented and surrounded by energy we build through what we eat and breathe. This second energy supply can be spent but can also be replenished. Dr. Balin suggested that you think of your ancestral energy as your savings account and the rest of your energy as your checking account. The goal is to live as much as possible from your checking account, making regular deposits, keeping enough on balance to cover your expenditures, and spending wisely. Eating high-quality food, breathing deeply and well, and exercising can build your energy checking account. High levels of stress can make inordinate demands on your resources, and energy is spent more rapidly than usual. If your expenditures exceed your income, you will start bouncing energy checks and will need to draw from your savings account. An illness could be seen as an overdraft notice, signaling that your account is depleted and that a deposit is required. With the rest often forced by illness, your system can rebuild its reserves and resume business. If you repeatedly overdraw your account, you could be closed out by the bank. Interestingly, Sile, in his first book, The Stress of Life, talked about energetics in a similar way. He referred to the energy of adaptation and conjectured that we all have a finite amount of this energy. Conserving it and using it wisely led to satisfaction and perhaps longevity, while worrying it away led to premature and perhaps unnecessary illness. From this viewpoint, relaxation techniques can be seen as ways to conserve energy. Your metabolism is significantly altered in the direction of energy conservation when you relax. Oxygen consumption and carbon dioxide elimination are reduced, both indicating a slowing of metabolism in the cells. Heart rate and blood pressure go down, brain rhythms slow, and muscle tension is reduced. The net effect is a reduction in the output of energy. Energy can be used to support your health and healing. Preparing to relax. The relaxation method I will teach you in this chapter begins with a variation of a method called progressive muscular relaxation, originated by a physician named Edmund Jacobson in the 1930s. Jacobson, a pioneer in muscle physiological research at Harvard, Cornell, and the University of Chicago, found that levels of muscular tension could be altered when people imagined themselves performing various events. He placed electrodes on muscles and had people imagine walking. The EMG, which measures electrical activity in the muscles, actually showed electrical signals in the walking muscles. Similarly, if he had people imagine eating a sandwich, their jaw muscles would become unconsciously activated. Jacobson saw muscular tension as a major problem in a wide variety of medical complaints and devised a systematic method for treating people to relax. While many other effective relaxation techniques exist, simplified variations of Jacobson's method are probably the most commonly used and easily learned forms of relaxation practice. The technique is easy to learn and easy to do, and it works. Make sure you have a quiet, private place to relax, and arrange to have at least 25 uninterrupted minutes. Take the phone off the hook, or turn on the answering machine. If you live with other people, tell them you don't want to be disturbed unless there is a true emergency. Wear comfortable clothing and loosen anything that is tight or restrictive. Dim the lighting. Make your environment as conducive to relaxation as you can. Once you've mastered relaxation, you'll be able to use it on the commuter train or in the midst of a busy day. But until then, make it as easy as possible for yourself. Most people find it easier to relax lying down, face up, while others prefer sitting in a comfortable chair or cross-legged on the floor. At first, take whichever position makes relaxing easiest for you. You can shift or move around anytime to become even more comfortable. Sometimes people find it easy to relax when lying down, that they fall asleep during the practice, and if this happens, then practice sitting up. Falling asleep will not harm you, but you won't get all the benefits of deep relaxation, and you won't be able to use this quiet, focused state for imagery if you're not awake. The script that follows, like all the others in the book, can be used in several ways. The least effective way is to slowly read the script to yourself, either mentally or out loud, pausing to sense the suggestive relaxation at the end of each phrase, because reading tends to draw your attention away from the experience of the relaxation. It is better to record the script on a cassette or tape player, reading it slowly, pausing at the end of each phrase, and using a soothing, relaxing tone of voice. If this is difficult to do, or you don't find your own voice soothing, perhaps you can ask a friend with a calming voice to record the script for you. A third option is to use the pre-recorded tapes I use with my patients. Whichever route you choose, remember that relaxation is a learned skill, like typing, playing a musical instrument, or playing any sport that requires coordination. You improve with practice. The more you practice, the more rapidly you'll improve. Since relaxation takes advantage of a natural response, it's easier to learn than most things you've already learned, and most people become quite confident in their relaxation ability within 2 weeks of regular practice. Chapter 4: Basic Relaxation Skills. Script. Prepare to relax by taking a comfortable position. Loosen any tight or restrictive clothing, and make sure you will be undisturbed for about 20 to 30 minutes. And remember, relaxation is something that happens all by itself if you let it. And learning to relax is learning to allow relaxation to happen. No one really knows exactly how you relax, but as you think about relaxing thoughts, your body responds by letting go. We don't really know exactly how you walk or talk or scratch your head. You just decide to do these things and your body responds. In the same way, it responds to your decision to let go and relax. As you learn to relax, please don't concern yourself with how quickly you are relaxing or whether or not you are relaxing deeply enough. You will find that as you practice relaxation, that at different times you'll relax at different rates. Sometimes relaxation will occur slowly and subtly, and other times you'll relax very deeply, very quickly. And it really doesn't matter how you relax or how deeply you relax at this time, just that you notice how relaxation feels to you when it does occur. As you begin to let go and begin to notice the sensation of relaxation that you have. As you practice this relaxation, you'll find yourself relaxing more easily, more quickly, as you become more familiar with how it feels. As you relax and let go of any tension you feel in your body, you may find numerous benefits, such as becoming more relaxed in general, or becoming more able to cope with the stresses of everyday life. You may be able to relax parts of your body that have become painful through chronic tension or stress, and reach an even deeper level of relaxation. Remember, if you can shift your position to become even more comfortable, please go ahead and do so. It will only help you relax more easily. The more comfortable you get, the deeper you can relax. You might like to know that when you relax, you need not lose your awareness of your surroundings. And just as a sleeping mother can ignore traffic sounds all night, yet awaken at the first soft murmur of her infant child, your unconscious mind can monitor your surroundings, allowing you to relax in safety. You can allow outside sounds and noises to be in the background of your awareness, since they are of no importance at all to you now. Yet, if there were any threat or danger to you while you were relaxing, you would become aware of that and instantly come awake, alert, and capable of dealing with the situation. Knowing this, you can begin to relax even more deeply by taking a couple of deep, slow breaths. And as you let go and exhale, let it be a real letting go kind of breath. And imagine yourself beginning to release any tension or stress that you may feel in your body. You may want to imagine that as you breathe in, you fill yourself with clean, fresh air and energy. And as you breathe out, you release tension, discomfort. Just imagine in some way leaving your body with your breath. All the tension and discomfort leaving. There's no need to force it. Just imagine it. Breathe in energy. Breathing out the tension. Good. Breathe in the energy. Breathe out the tension. Energy in, tension out. Energy in, tension out. Now let your breathing return to its natural rhythm. Breathing is a good example of an automatic process. So many millions and billions of autonomic processes happen in your body every moment of every day. Your heart beating, your blood circulating to every part of your body. The wondrously complex chemical reactions happening in every cell. All happening without your ever having to know exactly how it happens. And in the same way, relaxation happens. And feeling more comfortable. Now focus your awareness on your left foot. Merely notice any tension that may be there. And invite your left foot to relax and let go of the tension. Letting go of any tension you may be holding in your left foot. Releasing and relaxing. Allowing your left foot to relax more comfortably. Without any concern for how deeply or comfortably your left foot goes. Just noticing the sensation of letting go in that foot. The feelings of letting go now in your left foot. Allowing your foot to reach a deeper and more comfortable state of ease. A really enjoyable and pleasant feeling of relaxation beginning to deepen in that foot. And now notice any tension you may be holding in your right foot. Now release and relax your right foot. Notice any sensation of relaxation beginning to deepen in your right foot. In both of your feet, as you allow your feet to head for a deeper and more comfortable state of relaxation. Knowing that any time when you relax any part of you, the rest of you relaxes more deeply as well. And as you allow this relaxation in your feet to deepen, notice any tension you may be holding in your left calf. Releasing and relaxing any tension you may be holding in the muscles of your left calf. Just letting go and allowing it to relax. Not really worrying about how it relaxes. And notice any tension you may be holding in your right calf muscles. Now allow those to release and relax as well. Release and relax the muscles of your right calf. Notice the sensations of relaxing in your calf muscles. spreading down through your ankles and your feet, and allowing that sensation of relaxation in your feet, in your lower legs to deepen and continue as you notice any tension you may be holding in the muscles of your left thigh. The large muscles of your left thigh, they do so much work during the day, and release and relax the muscles of your left thigh. As you let go more easily and deeply, notice any tension you may be holding in your right thigh muscles. Release and relax the muscles of your right thigh, allowing your thighs to release more deeply and comfortably, and notice the sensations of comfort and release as they occur. Deepening sensations of relaxation. Just letting go, letting it deepen, almost as if it was happening all by itself. When you give it permission to relax, your body relaxes. Notice the pleasure and comfort, the enjoyable feeling of letting go and relaxing more deeply, and allowing that sensation of relaxation in your legs to deepen even more. Bring your attention to the muscles of your lower back and buttocks. Notice any tension in this very important part of your body, this hard-working part of your body, and release and relax any tension you may be holding in this area of your body, allowing those muscles to take a well-deserved rest. Just letting go of any unnecessary tension and stress in that part of your body, and noticing the pleasant sensations of relaxation coming into the large muscles of your lower back and buttocks. Notice any tension you may be holding in your pelvis and around your genitals. Allow that area of your body to release and relax, feeling a deeper and more comfortable sense of relaxation coming through your pelvis and your genital area. The whole lower part of your body now going deeper and more relaxed to a more comfortable level of body and mind. Release and relax any tension you may be holding in the muscles of your mid-back and your abdomen, allowing this area of your body to join in the sense of deeper, more comfortable relaxation. Release and relax any tension you may be holding in the organs in your abdominal cavity, feeling the entire abdomen releasing more deeply, easily, comfortably. Release and relax any tension you may be holding in the muscles of your chest and in the organs of your chest, in the muscles between and over your shoulder blades. Allow your entire chest to relax easily, deeply, comfortably, allowing the relaxation to deepen in every part of you as well. Not too deeply, just deeply enough for you to feel the most comfortable in your shoulders and the muscles of your shoulders, releasing and letting go, releasing and relaxing any tension in the muscles of your shoulders and your upper arms, allowing your upper arms to join in this pleasant and enjoyable sense of letting go of any tension in your arms and your elbows, releasing and relaxing any tension you may feel in your forearms now, your wrists, and down into your hands. Notice any tension in your hands, in the many small muscles in your hands, and inviting your hands to let go, to join in this deeper and more comfortable state of relaxation. Notice the pleasant feelings of relaxation in each individual finger. Your index fingers, relax your middle fingers, relaxing your ring fingers, your little fingers, your thumbs deeply and comfortably at ease. Now notice any tension you may be holding in the muscles of your neck, the muscles that hold your head up all day, and allow them to take a well-deserved rest. Releasing any tension you may be holding in your neck, just allowing it to go easily and naturally. Inviting your neck to join with the deep, comfortable state of relaxation that you feel in other parts of your body. And now release and relax any tension you may feel in your scalp and forehead. Notice a comfortable sense of relaxation beginning to come into the muscles of your scalp and forehead, flowing down through the muscles of your face, your cheeks, your jaw, relaxing your jaws, feeling a releasing and ease in your face, releasing any tension you may feel in the little muscles around your eyes, allowing them to let go, and imagine that pleasant sense of softening flowing down through your face, your neck, your shoulders, and all the way through your body. A very pleasant, comfortable, and deep sense of relaxation. And you may be finding that as your body has become more relaxed, your mind too has become more quiet and still. Please take a few moments to enjoy this deeper, more comfortable state of body and mind, allowing your mind to become quiet and calm and still, allowing the relaxation to deepen. Good. You will find that each time you practice relaxation, you'll be able to relax more quickly, more easily, and more deeply. Relaxation is something you learn, like playing a piano, or driving a car, or playing a game, and you get better and better as you do it more and more. Now to bring yourself back to awareness, bringing back with you a comfortable sense of this relaxation. All you need to do is count upward mentally from 1 to 5. Picture each number in your mind as you count up. When you reach the number 5, you can find yourself wide awake, alert, relaxed, and feeling better than before. You may feel refreshed as if you had just had a deep, refreshing sleep. You will come wide awake and alert, ready to go about your day. When you reach the number 5, in a moment, I will count from 1 to 5, and you can come back wide awake, feeling refreshed, relaxed, and better than before. Picture the number 1 in your mind's eye. Begin to come back to your awareness of the world and see the number 2. Coming more awake, sensing your body light and free of tension. Seeing the number 3, and become aware of the room you're in and the sounds around you, And imagine you are waking up from a deeply refreshing nap. When you reach 5, you can come fully awake and aware. See the number 4 and come more awake and alert. See the number 5 and your eyes can open, and you may want to stretch and smile to come all the way back, refreshed, relaxed, and feeling better than before. Chapter 4C, Evaluating Your Experience. When you come fully awake, take a few minutes to write about your experience and which parts of your body relaxed most easily, which took longer or didn't feel completely relaxed at all. What was the most interesting to you about the process? How relaxed were you? Did anything interfere with your ability to relax? And if so, how will you deal with that the next time you practice? Notice how you feel right after relaxation and an hour or so later. Compare the two and how you feel after relaxing to how you felt before you started. You are more comfortable? Did you have any pain or tension when you started and it isn't there now? Do you feel more refreshed? If you feel loggy or tired after relaxation, take more time to fully bring yourself out of that relaxation state. It will help to count upward again from 1 to 5 and to stretch and clench your fists or clap your hands to bring yourself fully awake. How often should I practice? Well, if you have a health-related problem, you should practice relaxation at least twice a day. Now, taking about 20 to 25 minutes per session. Morning and late afternoon sessions seem to work best for most people. The morning sessions put you in a relaxed yet alert frame of mind, which often helps the day run smoothly. Now, the afternoon session lets you release accumulated tension from earlier in the day and makes the evenings more pleasant. Some people find that relaxation helps them fall asleep if they practice at bedtime, but others find that it energizes them and keeps them awake. So experiment to find the best times for you to practice. If you relax regularly for 2 or 3 weeks, you'll condition your system to relax on cue, and you will find yourself more relaxed in general. Practice the basic relaxation exercise until you feel confident that your body relaxes when you give it the chance. Then go on to the deepening exercises that are described in the next chapter. Chapter 5, Going Deeper Within. While relaxation is often the beginning of healing, it won't cure everything, and it won't solve all of your problems. There are, however, benefits of relaxation that extend beyond its ability to relieve tension. These effects make it even more valuable as a foundation upon which to build your self-healing abilities. Number 1, learning to relax helps you to build confidence in your ability to control your body, your feelings, and your thoughts. You become aware of having more choice in how you react and how you feel. Number 2, relaxing helps you become more aware of what kinds of things, people, and thoughts tend to make you tense. This recognition is the very first step in being able to deal with them constructively. Number 3, relaxation interrupts habitual negative thought patterns and autosuggestions, and it clears your mind and opens it to a new idea, possibilities, ways of solving old problems. It allows you to draw on your intuition and creativity to help you move in the direction you want to go. Deep relaxation evokes a state of mind in which more advanced and specific imagery techniques are most effective. Let's look more closely at how each of these benefits can help you in your movement toward healing. Having a choice in how you feel. Learning to relax at will gives you a sense of confidence in your ability to focus your mind and influence your body. The sense of being out of control is frequently one of the most distressing aspects of being ill. And when you learn to change your physiologic state from distress to peacefulness, you are no longer powerless. Barry, an insurance agent suffering from a neck tension and pain, knew that his job was his major source of stress. He experienced a lot of pain relief when he practiced relaxation. After a few weeks of practice, he also said, "I used to think it was my boss who got me uptight. Now I see it's my reaction to him. And I don't have to get uptight when he walks through the office or says something to me. He can still get to me if he criticizes me. But now I can let go of it pretty quickly by practicing my relaxed method. I feel a lot freer than I did before, and I'm less trapped by my tension." Knowing how to relax can be a blessing even in the worst situations. 3 years ago, I was called to see a woman who was in the intensive care unit. Her husband and her internist and her lung specialist had all asked me to see if there was anything I could do for her. Martha was in her 30s, the mother of 2 small children, and was suffering from a uniformly fatal lung disease. Her lungs were becoming progressively thickened and her breathing increasingly inefficient and difficult. She had lost 30 of her 120 pounds and had been hospitalized for weeks in the ICU. She had tubes in her nose, mouth, bladder, and both arms, through which she was fed, oxygenated, hydrated, and relieved of urine. Her doctor said she had been vomiting every 2 hours for several days and was asking for higher levels of pain medication, which further inhibited her breathing, and she became disoriented several times and tore out her IV tubes and oxygen, so the nurses had to restrain her by tying her to the bed. The doctors and nurses in the ICU, who deal with death and tragedy daily, were almost overcome with a sense of helplessness and grief. I went to see her with a sense of dread, and I felt like I was being called on to perform some sort of miracle, and was acutely aware of my lack of ability to do so. I spent about 2 hours with Martha, just talking and listening, and we established a good rapport and talked about her college days in Berkeley, about her marriage, her children, her parents, her feelings about her situation. And finally I said, "I can't promise you magic, but would you like to learn to become more comfortable?" And she readily agreed. And I led her through the basic relaxation exercise that you just learned. She easily drifted into the most serene state of relaxation you could possibly imagine and soon fell asleep. I told the nursing and the house staff what had happened, and I left a relaxation tape there for Martha to play whenever she felt like it. 4 days later, she died, as expected, and the nurses reported she had not vomited again after learning to become more comfortable, and hadn't become disoriented or agitated. She had asked for no pain medication in the 4 days before her death. She had spent most of the time with her eyes closed, looking peaceful and content, and had been able to talk at length with her husband and children before she died. Martha showed me that even in the worst of circumstances, there may be choice, comfort, through very simple means. Identifying sources of tension. When you learn what relaxation feels like, you're better able to recognize the contrasting feelings of tension, allowing you to more accurately identify what makes you tense. This practice can be the beginning of your ability to deal with stress more effectively. Judith, a suburban mother, never noticed how tense she was while driving until she began practicing relaxation techniques. Soon afterwards, she began to notice that her shoulders became tense and painful within 10 minutes of beginning to drive, And once she noticed that, she found it was easy to shrug her shoulders and let them relax. After 2 weeks of relaxation practice and letting go of her habitual tension, she found herself naturally more relaxed and comfortable while driving. Developing enhanced creativity and problem-solving ability. Creativity and healing are closely related, and both involve bringing things together in new ways. New tissue is created as part of the physical repair process. New perspectives, which often emerge spontaneously during relaxation, may lead to changes in thinking and lifestyle patterns that can promote healing. Biofeedback research at the Menninger Foundation in Kansas has shown that people who train themselves to maintain a certain brainwave rhythm, theta rhythm, 6 to 8 cycles per second, often experience spontaneous insight into matters of importance to them. Deep relaxation slows your brainwave pattern to rhythms bordering on theta and may result in your spontaneously realizing something important to you for healing. Don't struggle to try to have new thoughts as you relax, but be aware that they may occur. Later, you will learn imagery techniques specifically aimed at stimulating this kind of insight. Setting the stage for skillful imaging. Relaxation techniques are the first step in learning to use your images, thoughts, and feelings skillfully. The ability to quiet your mind and concentrate your attention will enable you to make the best use of the more advanced techniques that you will learn in the following chapters. Deepening your relaxation with imagery. Now that you've developed new confidence in your ability to relax, it's time to learn how to deepen your relaxation. The simple deepening method I will teach you build on the same basic skills you've already learned, and they'll help you to deepen your inner concentration, which will improve your responsiveness to the images that you will create in later exercises. The deepening technique script will again guide you through your body, inviting each part to relax, and then add 2 simple imagery techniques for deepening. First, you will imagine yourself walking down a staircase. With each step you take a little deeper and a little more relaxed. Then you will imagine yourself in a beautiful, peaceful, serene, and safe inner place. There is less introductory material in this exercise, and you can move through your body a little more rapidly than before. This exercise now replaces the basic relaxation. As with all the scripts in this book, you may want to read it slowly to yourself, going along with the suggestions. Have a friend read it to you, make a tape you can listen to, or use the pre-recorded tapes. Take a comfortable position and make sure you will have about 25 minutes of uninterrupted time. The script, Deepening with Imagery. Begin to relax by taking a comfortable position, loosening any tight or restrictive clothing or jewelry, and making sure you won't be disturbed for about 25 minutes. Take a couple of deep, slow breaths, and let the out breaths be real letting go kind of breaths. As you are beginning to release any tension or discomfort in your body. Now that you have learned to relax, you will find that your body and mind relax more quickly and more easily than ever before. As you focus your attention on each part of your body, you can invite it to release and relax any tension that may be there, and then merely allow it to release in its own way. Focus your awareness on your left foot. Invite your left foot to release and relax any tension it may be holding. Notice the beginning sensations of relaxation in that foot. In the same way, now invite your right foot to release and relax any tension that may be there. Invite the muscles of your left calf and shin to release. And let your right calf and shin do the same. Just notice and allow your lower legs to relax in their own way, becoming more comfortable and at ease all the while. Remember, as each part of you relaxes, all of you relaxes more deeply. And as you relax more deeply, each part can relax even more easily. Invite your left thigh and hamstrings to release and relax. And your right thigh and hamstring, releasing and relaxing. Allow your hips and pelvis to join in this letting go and releasing of tension. Allow your entire lower body to release and relax. And notice the relaxing sensations. Allow it to be a comfortable and pleasant experience. Invite your lower back and buttocks to join in the releasing and relaxing any tension that may be there. And your genital area, invite your abdomen to relax, the muscles of your abdomen and your mid-back. Invite all these to join in this deeper, more comfortable state of relaxation. Invite the organs in your abdominal cavity to also join in this letting go, this release. And just allow that whole lower half of your body to let go and become even more deeply comfortable and at ease. Invite your chest muscles and the muscles in your shoulder blades to release and relax, becoming soft and at ease. The organs in your chest joining in this deeper, more comfortable state. Imagine your shoulders and neck muscles becoming soft and releasing any and all tension that may be there, allowing them to take a well-deserved rest. And this relaxation is flowing down over your shoulders into your upper arms, your elbows, into your forearms, into your wrists and hands. Invite all the small muscles of your hands in between your fingers to release and relax and become very comfortable and deeply relaxed. Your index fingers, your middle fingers, ring finger, little fingers, and your thumb, all deeply relaxed, all the way to the very tips. Allow your scalp and forehead to release and relax any tension that may be there, becoming soft and smooth and at ease. The muscles of your face soft and at ease, and allowing a very pleasant sense of relaxation to come into the small muscles all around your eyes. Inviting those muscles to release any tension and to feel that sense of letting go flowing through your face and your jaws, neck and shoulders, and all the way down. And as your body relaxes more deeply, your mind becomes quiet and peaceful as well. Now, to deepen this comfortable state of relaxation and concentration, imagine yourself at the top of a stairway that has 10 steps leading down from where you stand. Let it be any kind of stairway, one you've seen before or one you just made up. And take some time to observe it in detail. Notice what the stairs are made of, how steep or how shallow they are, how wide or how narrow. Do they go straight down? Do they spiral? Or is there a landing halfway down? Are the stairs covered with anything? What is the texture beneath your feet? Is there a banister or handrail to hold as you go down? When you are ready, begin to descend the staircase, one step at a time, counting backward from 10 to 1 as you go, one number per step, allowing yourself to feel more deeply, more comfortably relaxed with each step you descend. Let this imaginary staircase help you reach an even deeper, more comfortable level of body and mind with each step down. 10, 9, deeper and more comfortably relaxed. 8, each step takes you deeper. 7 and 6, easily and naturally. 5, halfway down with nothing to worry, nothing to bother. 4, deeper, more comfortably relaxed. 3, no need to worry about exactly how deeply or how comfortably you go. 2 and 1. At the bottom of the stairs, very comfortable and deeply relaxed in body and mind. To further deepen your relaxation, imagine yourself now in a very peaceful, beautiful place. This might be somewhere you've visited before or somewhere you make up in your imagination. Just let the image of this place come to you. It really doesn't matter what kind of place you imagine, as long as it's beautiful, quiet, peaceful, and serene. Let this be a special inner place for you. Somewhere that you feel particularly at ease. A place where you feel secure and at one with your surroundings. Maybe you've had a place like this in your life. Somewhere you go to be quiet and reflective. Somewhere special and healing for you. Or it could be a place you've seen in a movie, or read about, or just dreamed of. It could be a real place, like a meadow, or a beach, or an imaginary place, like floating on a soft cloud. Let yourself explore whatever quiet, imaginary place you go to, as if you were there now. Notice what you see there, and what sounds you hear, even the smells or aromas that you sense there. Notice especially what it feels like to be there, and immerse yourself in the beauty, the feelings of peacefulness, of being secure and at ease. As you explore this special inner place, a spot where you feel especially calm, centered, and at ease, let yourself become comfortable and centered in this spot. Let this be your power spot, a place in which you draw from the deep sense of peacefulness you feel here, a place of healing and of rest, a place where you can explore and use the power of your imagination to best effect. Take some time to relax into the deep feelings of peacefulness, quiet, and healing that you can sense in this spot. Take as much time as you need. And when you are ready, prepare yourself to come back to your waking state. Remember, this is your special inner place, a place you can return to at any time of your own choosing, a place within where rest, healing, and peace are always available, a place that is always with you, and a place you can draw from when these qualities are needed. But bringing back with you the sense of peacefulness and healing you have experienced here, all you need to do is recall the imaginary staircase you descended. Imagine yourself at the bottom of the stairs with 10 steps up. As you ascend the stairs, you become more and more wide awake, alert, and aware of your surroundings. When you reach the top at 10, let yourself come wide awake, alert, and refreshed, feeling better than before. 1, 2, coming up, coming more awake. 3, 4. When you reach 10, you may open your eyes, stretch, and come all the way wide awake. 6, feeling refreshed as if you had a very good nap. 7, at 10, you will be wide awake and alert, feeling very good and refreshed. 8, your eyes may start to feel like they want to open. 9 and 10, at the top of the stairs and wide awake, open your eyes, stretch, smile, and come alert, refreshed, and wide awake again. Evaluating your experience. Again, take a few minutes to write about your experience. Were you able to imagine descending the staircase? What was it like? Could you feel or imagine yourself going deeper as you moved down the stairs? Did your experience seem to change in any way as you moved down? What was your inner quiet place like? Was it new or familiar to you? Do you have any particular associations or memories connected to this place? How did it feel to imagine yourself there? If you didn't feel you found a suitable quiet place, read on for some suggestions that will help you do that. Several pointers may help you use this deepening technique even more effectively. First, remember that this is a skill you are developing. Take your time with it and experiment until it works well for you. Some people, for instance, find that going down 20 stairs helps them reach the most comfortable level of relaxation, while others find that just 5 stairs is enough. And you may find you can control the depth of relaxation by varying the number of stairs that you go down. Charles, a patient with a recurrent back problem, became quite good at relieving his back muscle spasms with relaxation techniques. and once he severely sprained his back while traveling, found himself with intense pain and muscle spasms and no easy access to medical care. He tried to relax, but with little success, due to the severity of his pain. After several attempts, he decided to imagine a staircase with 100 stairs, vowing to go as far down as he needed to go to relax. He remembers reaching the high 70s, falling asleep, and waking up a few hours later feeling considerably better. Now, second, it may take some inner traveling before you settle on a place that feels just right. And you might imagine going several places before you find the one that feels best. It's also perfectly alright to have more than one special inner place. Remember, this is your imagination, and travel is cheap here. And at these prices, you can afford to have a house in France and a beautiful tropical island all your own. You may find that you use different inner places for different purposes, like going to a sunny beach for rest and relaxation, but to a mountaintop to get an overview of a situation. You might be more comfortable using one special place consistently. The most important thing is to respect what feels best to you. This is your special inner place, a place of comfort and peace and sanctuary. While people commonly imagine mountains, lakes, tranquil meadows, quiet forest clearings, and other beautiful natural settings, one patient of mine found her special place was playing slot machines in a Las Vegas casino. It also helps you relax more deeply to imagine not only the sights you see, but also the sounds you hear, the aromas you smell, and the feelings you experience in your imaginary special place. Using all your senses in imagery involves more of your brain in the process. It makes the imagery experience more real to your lower brain centers. Thus, they are more likely to respond to those images, giving the all-clear message to the body and allowing it to relax. Once you're comfortable with your ability to relax and go to your quiet inner place, you will want to begin to experiment with creating images specifically aimed at relieving your symptoms or stimulating your healing process. The next several chapters will teach you how to do this, beginning with simple directive images and visualizations, and moving to receptive imagery techniques that can help you develop a more specific vision of how to support your healing. Chapter 6. Creating Your Own Healing Imagery. Now that you've learned to relax, you're ready to begin using imagery in more specific ways to improve your health. Imagery is a two-way medium of communication between your silent unconscious mind and your verbal conscious mind. It can be used both to illuminate the patterns that affect your health and to focus energy that can change those patterns. These receptive and active modes of imaging have complementary functions in self-healing. Receptive imagery helps you become aware of unconscious patterns, needs, and potentials for change. It simply involves paying attention to the imagery that arises in response to the questions you ask in a relaxed, respectful state of mind. Active imagery, on the other hand, communicates your conscious intentions, or requests, if you will, to your unconscious mind. It too is a simple process that consists of imagining your desired goal as if it is already achieved, while maintaining a passive, relaxed state of mind. Together, receptive and active imagery can help you create the most appropriate and effective healing imagery for you. What are the best images for healing? Research psychologists Jean Achterberg and Frank Lawless at the University of Texas Health Sciences Center at Dallas studied the imagery of cancer patients working with the Simonton method of visualization and have been able to correlate between characteristics of their imagery with improved survival rates. Their findings indicate that the more powerful and active the imagery of healthy immune system function, the better the outcome for the patient. Anatomical accuracy does not seem to be a factor in effectiveness, and in fact, symbolic representation of healing activity often seems to be more effective. Other studies, however, have shown that in some situations, imagining the anatomic and physiological details of healing seems to improve results, in some cases. In a study conducted at a behavioral medicine unit at the University of California at San Francisco, patients with asthma were taught relaxation and visualization techniques aimed at relieving their breathing difficulties. One group of patients was taught to imagine breathing easily through wide open bronchial tubes. Another group was taught to a much more detailed model of asthma. In asthmatics, there are certain cells called mast cells lining the airways that are hyperreactive to various stimuli. And when they react, they release a chemical called histamine that causes the airway constriction and difficulty in breathing. This second group of patients imagined those mast cells being calm and stable, holding their histamine inside. While both imagery groups experienced improvement in their asthma, the group visualizing the stable mast cells improved more. Now, these seemingly conflicting findings are not really contradictory. In the second study, patients didn't have the option of creating their own personalized imagery. Instead, they were taught one of two pre-selected imagery scenarios. I wonder how a group that was encouraged to develop a personal image of asthma and of easy breathing would have fared. Studies will soon be done to explore this issue. My guess is that the second group in the asthma study become more deeply interested and involved with their imagery as they learned more about the nature of their illness at a cellular level. My experience is that imagery is most effective when it has a personal meaning to an individual and when it invokes a positive emotional response. The strongest images of healing feel right and powerful, and they will cause a perceptible shift in feelings. The patient may even experience an immediate response in sensations associated with the symptoms involved. Not everyone will receive an image this powerful, however, at least not right away. In the absence of such an image, an anatomical image can often be effective and is an excellent place to start. When you create an image of anatomical or physiological healing, detailed information can help make the image more powerful. Ask your doctor or healthcare practitioner to explain your symptoms or illness in terms you can understand and visualize. Ask her how healing could happen if it were to occur. Look at the many anatomy and physiological guides now available. I've listed some of the best in Appendix B. I'm not sure whether it is an imagining the process in detail or the willingness to invest the time and attention to learn about the detail that will make the difference. But in either case, using imagery in this way does seem to have a very powerful effect. Whatever imagery you choose to focus on, the frequency of practice seems to be a particularly important factor in the effectiveness. People who practice their imagery most often and enthusiastically receive the most benefit. So when you begin to use imagery, use it often and use it wholeheartedly. The method you will learn in this chapter to develop your personal healing imagery is simple and direct, and makes use of both receptive and active imagery. A script follows that will lead you through the process. You'll relax and go to your quiet inner place. When you're calm and centered, you will focus your attention directly on the symptoms that are most bothersome to you. If no symptoms are associated with your illness, then you can focus on the area of your body that's involved, or on the name of the illness. Once you're calmly focused, you will let an image come to mind that represents this problem or the symptom, and accept whatever image comes to mind, and welcome it into your awareness. It may be familiar or strange, and you may or may not understand how it is connected to your symptom. You'll let it be whatever it is, and allow it to become clearer. You will observe it carefully and in detail. Then you will be asked to notice what seems to be wrong with the picture. What seems to represent the pain, illness, or problem? Up to the point you use this receptive mode of imagery. Next, you will be asked to allow another image to form that represents the healing or the resolution of your problem. You'll imagine the healing process taking place in whatever way seems right to you as the image of illness changes to the image of health. In the healing imagery script, you will be encouraged to imagine feeling positive changes happening in your body as you focus on the healing image. Notice any change in sensations and take them as signs of encouragement, of connection to your body. By using receptive imagery to help you form your active imagery, you invite your silent mind to guide you in this process. You allow it to reveal its perception of the problem and the potential solution. Healing, after all, is an unconscious process, and your unconscious is the part of your mind that understands it. By eliciting and affirming its own image of healing, you use its native language to encourage it to carry out the process. The image you create may be anatomically correct or purely symbolic. The most important thing is that it is yours. Though using an image that is your own is most important, a few examples of images that others have created might help you realize how different and personal the imagery can be while still being effective. Consider 3 people with back problems. An orthopedic surgeon friend of mine had a severely herniated lumbar disc. He was a very progressive surgeon who had used hypnosis to help his patients recover quickly from surgery. He believed in the power of the mind to assist healing. He doubted, however, that imagery could help repair a ruptured intervertebral disc. But he wanted to do anything he could to avoid surgery. He was able to visualize the disc quite well, since he had seen so many of them in his work. He described it as a fibrous sac whose contents had blown out and were now pressing on a nerve in his back. He couldn't imagine a satisfactory way for it to be repaired without surgery, and became increasingly frustrated. Finally, he decided to relax very deeply and see if the image could change by itself. Suddenly he saw a vivid image of the center of the disc being sucked back into the sac, and the tear sealing itself up like the diaphragm of a camera. The image was so clear it startled him. He was even more startled to find that after this session he was greatly relieved of pain and was able to walk without pain coursing down his leg for the first time in several weeks. He went on to recover completely without surgery, a fact that has both pleased and amazed him since. Another friend and patient with a recurring back problem would imagine a huge knot in a rope representing the muscle spasms in his back. As he relaxed, he could visualize the knot loosening and found that his back muscles completely relaxed by the time he was able to imagine the knot untied. And a third patient, with a 1-year history of severe, unremitting back pain, imagined a knife stabbing him in the back. In guided imagery, he was asked to look at who put the knife there. He saw his former business partner, who had stolen from and ruined their business. A brief course of counseling sessions helped him express and come to terms with the feelings of anger and loss that he'd been holding inside, and his back pain disappeared as he worked through his feelings. The point here is that a similar problem may produce different images in different people and may lead in different directions for healing. Sometimes active imagery will suffice to relieve pain and stimulate healing, while in other cases, receptive imagery will point to physical, emotional, or situational problems that need resolution before the healing can happen. Let's look at some other images that my patients have created of their illnesses and their healing processes. Remember that while creating is not quite the right word, receive might be better. Now, these images came to my patients when they concentrated on the problem and stayed receptive to the images that formed. A man with a painfully inflamed wrist imagined his wrist bones having sharp, jagged edges that grated on one another as he used his hand. In contrast, the image of his normal wrist included round bones with rubber and cotton cushions between them, allowing smooth, painless movement. In his healing imagery, he imagined gently placing cushions and supports between the bones of the painful wrist and was able to greatly reduce his discomfort as his wrist healed. And although his imagery was not anatomically correct, it was effective in reducing his pain. A young man with ulcerative colitis had been experiencing painful abdominal cramping and bleeding from his rectum for 2 months. Medication was not helping, and he wanted to avoid cortisone if he could. He imagined his colon being red, raw, and irritable, and he said it seemed uptight and oversensitive. As he relaxed with his hands on his abdomen, he imagined his hands melting into his body and lovingly stroking and massaging his colon. He imagined his colon relaxing and resting in his hands. At the same time, he felt a pleasant sense of warmth in his belly and imagined fresh, healthy blood flowing to his colon, refreshing, cleansing, and healing it. In 2 days, he was free of symptoms. 3 weeks later, his gastroenterologist said that his colon appeared to be completely healed. A 65-year-old retired heavy equipment operator with a herniated disc in his back imagined a tiny work crew inserting house lifting jacks between his vertebrae. When he imagined them clearing out the old busted disc and installing a fresh one, which he visualized as a small, very rough rubber ball. When the work crew lowered the top vertebra, the ball flattened into a cylindrical shock absorber, which maintained the space between the bones. He even imagined it cushioning the joint as he walked. He found this image to be a consistently effective way to relieve his back pain sciatica. A 30-year-old woman with endometriosis visualized her disease as tar stuck to her pelvic organs. She imagined having a potent cleaning solution, a scraper, and a mop, and she mentally cleaned up every last bit of the tar. She consistently visualized this process for 15 minutes, 2 or 3 times a day. 3 months later, had no visible endometriosis when her gynecologist examined her through a laparoscope. A 52-year-old businessman with a peptic ulcer visualized spraying the insides of his stomach and intestines with a cooling white foam 3 times a day between meals, and was able to not only relieve his pain, but heal quickly and discontinue his ulcer medications, and remain free of ulcers, though through several stressful years. A mother of 3 with a week-long sinus headache focused on her pain and saw a large eye with wings on either side. As she watched it, it suddenly flew away, and a large glob of mucus fell into the back of her throat. She was surprised to sit up and find that her headache was relieved. Neither she nor I ever understood the significance of that symbol, and it seemed as if the imagery itself had produced the relief. A 27-year-old junior executive was having anxiety attacks at work. As he relaxed and asked for an image for his anxiety, he saw a frenetic honeybee flying about in an agitated state. Now the bee seemed scattered, without any pattern or direction in its movement. The image for healing that came to him was a rose. He imagined holding the rose out to the bee, which came over and began collecting nectar. The bee seemed more relaxed and content, and so did the young man. He found that this simple visualization calming and centering, and used it for a few minutes at a time whenever he began to feel anxious and scattered like his imaginary bee. In later chapters, I will describe other cases in which imagery has led people to a deeper understanding of how they could contribute to their own healing. The script that follows, however, will allow you to begin using both receptive and active imagery to begin that process. As with all the imagery exercises in this book, let this be an exploration, and remember, there's no right or wrong imagery, but be respectful of your own imagery and carefully observe what comes. You may use the script that follows as you have the others, making sure you have a comfortable, quiet space in which to concentrate and about 20 minutes of uninterrupted time. Script: Your healing imagery. Begin by taking a couple of deep, full breaths and let out the breath. Let the out breath be a real letting go kind of breath. Make sure you are comfortable and that you won't be disturbed for 20 minutes or so. As you breathe comfortably and easily, invite your body to relax and let go of any unnecessary tension. Take the time to bring your attention to each part of your body and invite it to release and relax as you have so many times before. Release and relax any tension you may have in your left foot, your right foot, your calves, your thighs and hamstrings, your hips, your pelvis, genitals, lower back, buttocks. Now take your time and sense the comfortable feelings of deepening relaxation beginning in the lower half of your body. Easily, naturally, invite your abdomen to release and relax and join in this more comfortable and pleasant state of relaxation. The organs within your abdomen, your mid-back and flanks, your chest, the muscles across and between your shoulder blades, deeper and more comfortably at ease. The organs in your chest, breathing easily and naturally. Your shoulders and neck, relaxing more deeply, more comfortably, and more easily. As each part relaxes, you relax more deeply, and as you go deeper, it is easier to relax. The relaxation is flowing down your upper arms to your elbows and forearms, flowing to your wrists and your hands. Sense the relaxation in the small muscles between your fingers, all the way to the tips of the index finger, your middle fingers, the ring fingers, your little fingers, and your thumbs. Scalp and forehead soft and relaxed. The muscles of the face soft and at ease. The little muscles around the eyes relaxing more deeply, more pleasantly, more comfortably. Imagine yourself at the top of your imaginary staircase that leads to an even deeper and more comfortable state of mind and body. Notice what it looks like today and descend one step at a time, going deeper, more comfortably relaxed with each descending stair. Let it be an enjoyable experience. Head for that special inner place of peacefulness and healing you have visited before. 10, 9, deeper, more comfortably relaxed as you go down the stairs. 8, 7, not being concerned at all with how deeply you go or how you go more deeply. 6, easy, comfortable. 5, just allowing it to happen. And 4, comfortable and pleasant. 3, 2, body relaxed, yet your mind still aware. 1, and go in your mind to a special inner place of deep relaxation and healing. An inner place of great beauty, peacefulness, and security for you. A place you have visited before, or one which simply occurs to you now. It really doesn't matter where you go now in your mind, as long as the place is peaceful, beautiful, and healing to you. Take a few moments to look around this special inner place and notice what you see, what you hear. Perhaps there's an odor or aroma here. And especially notice any feelings of peacefulness, safety, and connection that you feel here. As you explore, find the spot where you feel the most relaxed, centered, and connected in this place. Become comfortable and quiet in this place. When you're ready, focus your attention on the symptoms or problem that has been bothering you. Simply put your attention on it while staying completely relaxed, allowing an image to emerge for this symptom or problem. Accept the image that comes, whether it makes sense or not, whether it is strange or familiar, whether you like it or not. Just notice and accept the image that comes for now. Let it become clearer and more vivid, and take some time to observe it carefully. In your imagination, you can explore this image from any angle and from as close or far away as you like. Carefully observe it from different perspectives. Don't try to change it, just notice what draws your attention. What seems to be the matter in this image? What is it that represents the problem? When you know this, let another image appear that represents the healing or the resolution of this symptom or problem. Again, simply allow it to arise spontaneously. Allow it to become clearer and more vivid. Carefully observe this image as well, from different perspectives. What is it about this image that represents healing? Recall the first image and consider the two images together. How do they seem to relate to each other as you observe them? Which is larger? Which is more powerful? If the image of the problem seems more powerful, notice whether you can change that. Imagine the image of healing becoming stronger, more powerful, more vivid. Imagine it to be much bigger and much more powerful than the other. Imagine the image of the problem or symptom turning into the image of healing. Watch the transformation. How does it seem to happen? Is it sudden, like changing channels on a television? Or is it a gradual process? If it's a process, notice how it happens. Notice if what happens seems to relate to anything in your life. End your imagery session by focusing clearly and powerfully on this healing image. Imagine it is taking place in your body at just the right place. Notice whether you can feel or imagine any changing sensations as you imagine this healing taking place. Let the sensations be sensations of healing. Affirm to yourself that this is happening now and that this healing continues in you. Whether you're waking, sleeping, imagining, or going about your daily activities. When you are ready, prepare to return to your waking consciousness. Imagine yourself at the bottom of your imaginary staircase and begin to ascend. 1, 2, allowing this image of healing to continue to work within you. 3, becoming more and more aware of your surroundings. 4, when you reach 10, you may come wide awake and alert, feeling refreshed and better than before. 5, lighter and lighter. 6, aware of the room you're in. 7, feeling refreshed and relaxed and better than before. 8, almost wide awake now. 9, your eyes may want to open up now. And 10, allow your eyes to open and come fully wide awake, feeling refreshed, relaxed, and better than before. Stretch and smile and go about your day. Evaluating your experience. Take some time to write about and or draw your experience. Describe the image of your problem in detail, and then the image of your healing. Were your images primarily physical and anatomical, or were they symbolic in some way? Notice your thoughts and associations with these images. If they remind you of someone else in your life, make a note of that. Did any feelings come as you experienced this process? Did you feel any shift in the feeling, sensation, or character of your symptoms from doing the imagery? Using drawings as imagery. If you had trouble finding an image, it may be helpful to doodle or draw your symptom, illness, or problem. Use crayons, oil pastels, colored pencils, felt pens, or any drawing implements that you may have. Use big sheets of paper and just let your hand draw freely as you focus on your problem. Trust your instincts and let the drawing develop according to what feels right to you. And don't be concerned about the artistic quality of your creation. The point here is to learn something, not to create a work of art. You might even want to let your non-dominant hand do the drawing. If there are words or a phrase that comes to mind as you draw, write those down somewhere on your drawing. When your drawing seems complete, take some time to consider how you have depicted your problem. What does it tell you? What seems to be the problem? When you feel you've learned what you can from this drawing, let yourself make another drawing that represents the process of healing. Let this drawing too emerge spontaneously. Just follow out whatever wants to form. One of my patients said, I just let my hand please my vision, and I'm always surprised at what I end up with. You may want to use these drawings to help you visualize more easily. Put them up where you can see them and use them as a way to focus your attention when you begin your healing imagery sessions. If you found drawing helpful, you can use it to help you with any of the other imagery scripts in this book. Working with your healing imagery. When you imagine healing taking place within you, imagine it happening in the present. This may be difficult if you're feeling ill or in pain, since the imagery may conflict with your experience. If you have a splitting headache, it may be hard to maintain a calm focus on an image of a cool, soothing stream washing your pain away. Stay relaxed and persevere. Fake it till you make it. Think of healing imagery as an affirmation, a suggestion that will begin to lead you in the direction you desire. Even if you don't feel relief right away, be patient and consistent as you imagine the healing process as vividly as you can. Your imagery can change more quickly and easily than your body. And physical healing, especially when you have a long-standing problem, may take some time. How often should you have a healing imagery session? As often as you need to. If you have an intermittent symptom, and as often as you can if you're dealing with a chronic, difficult, or serious illness. And no one knows the dose-response relationship of this technique yet, but it seems that people who really believe in imagery will do it more often, more enthusiastically, and more carefully. And they also get the very best results. Relax and focus on your healing imagery as often and as clearly as you can. Even while you're going through your daily routines, you can close your eyes and briefly reaffirm your imagery. You may even find that you can do it without having to close your eyes. Every time you focus on the image, it becomes stronger, and over a few weeks, it becomes lodged in your unconscious mind. Using imagery is just like anything else that's new to you, like learning to play an instrument or a sport. At first it feels strange and unfamiliar, but the more you do it, the more comfortable it will become, until you can do it automatically, without even thinking about it. The Simonsons have recommended using healing imagery for 15 minutes 3 times daily as a guideline for their cancer patients. For most medical problems, I encourage my patients to use it at least twice a day for 10 to 20 minutes at a time for several weeks. Don't forget, you may be working to replace an image of illness that you've carried with you for months or years, and it may take some time to work. You may begin improving as soon as you start using this healing imagery, or it may take some time to notice any effect. If you have frequent symptoms, you should be able to notice some changes within 2 weeks of regular practice. You may have dramatic relief, or it may be more subtle. Consider any benefit you receive from your practice a sign that you are working in the right direction, and continue your work. If something you do in your imagery makes you feel worse, don't give up your efforts. If you can make yourself feel worse, you can probably make yourself feel better. Pay attention to the imagery that makes you feel worse. Imagine yourself doing the opposite of whatever you were imagining. When you find an image that brings up feelings of improvement, stay with it. If you're working on a problem that isn't accompanied by symptoms such as many cancers, you may not be able to tell if the imagery is helping until your next medical evaluation. On the other hand, you may notice you feel refreshed, relaxed, and more confident and optimistic after doing imagery. That is encouraging and worthwhile in itself. When I evaluate patients who want to use imagery this way, my first concern is to identify clearly the safe boundaries in which we can work. We identify the signs and symptoms that signal patients to call for a medical evaluation, and we select a period of time in which to evaluate their progress. You should do the same. Determine a reasonable time for reevaluation in consulting with your doctor or health professional. Try to give yourself a minimum of 3 weeks and 3 months if you have a long-standing problem. Then reevaluate your condition and assess your process and progress. If you have improved, continue working with your program. If you haven't, experiment with your imagery until you find an image that feels more powerful to you. Have you given it your best shot? Or is there more you could do? In either case, especially if you haven't improved, you may want to use the techniques in the next 3 chapters to improve your ability to support your own healing. Chapter 7, Your Inner Advisor. A Navy veteran talks with an imaginary old man called the Helper and learns how to rid himself of chronic asthma. A female advertising executive follows the advice of a willowy young woman named Laura, whom she meets in her imagination. As a consequence, she puts full-spectrum lighting in her home and office, and is greatly relieved of severe allergies. An imaginary figure named Ricardo counsels a young psychiatrist. You are a healer, but before you can heal others, you must learn to heal yourself. Ricardo shows him a way to conduct therapy without experiencing the recurrent neck pain that has plagued him for months. Is this spooky? Well, not really. Having a talk with an imaginary wise figure, an inner advisor, may sound strange, yet doing it is one of the most powerful techniques I know for helping you understand the relationship between your thoughts, feelings, actions, and health. We have much more information inside us than we normally use. An inner advisor is a symbolic representation of that inner wisdom and experience. Think of your inner advisor as a friendly guide to these valuable unconscious stores. An inner ally who can help you understand yourself more deeply. Have you ever struggled with a problem and ultimately came to terms with it by listening to this still small voice within? Do you pay attention to your gut feelings when you make important decisions? Or perhaps you have dreams that enlighten or guide you. Do you have flashes of insight, good hunches, all of the above, are ways you may be guided by something deep inside, a part of you usually hidden from your conscious awareness. Imagining this guidance as a figure that you can communicate with can help to make it more accessible. Your inner advisor may offer advice in areas as diverse as nutrition, posture, exercise, environment, attitudes, emotions, and faith. Your advisor can serve as an ambassador to that part of your mind that thinks in images and symbols, as a liaison figure between the silent and verbal brains, the unconscious and the conscious minds. Let's look closely at the three people I mentioned at the beginning of this chapter. Frank, a 28-year-old former naval officer in Vietnam, suffered from recurrent chronic asthma, which grew worse when he started a job as a rural deliveryman and had to pass hay fields and horses every day. Standard asthma medications only partially relieved his distress, and he didn't want to take steroid medications if there were any alternative. Testing confirmed that he had strong allergies to both hay and horse dander. He didn't want to give up his job, which he both liked and needed, and was referred to me for help. With some skepticism, Frank agreed to explore his illness through imagery, and as he relaxed and looked inside for an inner advisor, he saw an image of a stern older man working on a machine who called himself the Helper. Now the man reminded Frank of his grandfather who had raised him on his farm. In imagery, Frank saw himself as a small boy being punished by having to sweep out the horse barn, a job he hated. He saw himself beginning to wheeze while doing it, and his grandfather telling him that he didn't have to finish the job. Later in his imagination, the Helper told Frank that now he was a grown man and he could choose which jobs he was willing to do. He could refuse a job he didn't want without needing to get sick to get out of it. Hearing this, Frank felt relieved, and his breathing improved. He was able to continue his route without asthma, and has not suffered a reoccurrence in 10 years. The young woman executive, Justine, had allergies to many foods and chemicals. She, too, was reluctant to work with imagery, but she finally became desperate enough to try. When she asked Laura, her advisor, about her allergies, she held out her hand and revealed a prism in her open palm. A single beam of white light entered the top of the prism and was refracted into a rainbow spectrum of light that radiated toward Justine. When Justine asked Laura to explain what this meant, she answered, "You have light compression." She would say no more. Puzzled, I encouraged Justine to keep the image in mind throughout the week and meet with Laura again to see if she would clarify the message. 3 days later, while looking through some old books, Justine came across a book that a friend had given her months before, entitled Health and Light by John Ott. Ott, the inventor of time-lapse photography, was also a pioneer in the field of photobiology, the effects on light and living organisms. In his book, he marshals evidence to support the view that full-spectrum sunlight is a nutrient needed for healthy human function. He believes that spending long days and nights in artificial lighting is a significant cause of illness in some people. In a flash, Justine understood what Laura had been telling her. She went into her relaxed state and summoned Laura, who confirmed her discovery. With Laura's guidance, she devised a plan to correct the situation. She replaced all the light bulbs at home and in her office with full-spectrum bulbs, agreed to go outside and be in the sun for at least 30 minutes a day, and asked her boss for a desk near a window. Within 2 weeks, she reported herself almost completely free of allergies, and she remained that way for 18 months without further treatment. The psychiatrist Art had recently completed his training and was working intensely in private practice. He began to experience severe pains in his neck, chest, and shoulders, especially when he was with his patients. As Art talked with his advisor, Ricardo, an image of himself in a suit of heavy armor appeared. The armor rested on his shoulders and chest. Ricardo told him the armor was there to protect him from his feelings, but it stood in the way of him being an effective therapist. He said the armor was made of thinking and planning, and Art would need to discard it if he was going to be of any real help to his patients. Inner guidance, a common belief. Talking with an inner advisor is not a new idea. Most of our major philosophical, religious, psychological traditions concern inner guidance in one form or another. Many cultures use rituals that include music, chanting, fasting, dancing, sacrifice, and psychoactive plants to invoke a vision that could inform and guide them at important times. Native Americans would go into the wilderness, unarmed, without food or water, build a sweat lodge, and pray for contact with a guiding spirit. From such a visionary experience, they would draw their names, their power, and their direction in life. The medicine man of the tribe might make a similar quest in search of healing for an ailing tribe member. Catholic children are taught in catechism that they have a holy guardian angel who protects them and who can be called on in time of need. Many other religions teach a similar idea. Children, whatever their religious or cultural background, often have imaginary playmates who talk with them and play with them and protect and support them in their play. A surprising number of people tell me they talk to spouses or loved ones who have died. Now, in their talks, they receive advice and comfort, as people do when they talk with their inner advisors. All of these experiences point to a common human notion that there is guidance available for us and to us when we appeal to it and are receptive to it. Meeting with an inner advisor is a way of making this intuitive guidance more available to you. Intuition is defined as power of knowing without recourse to reason, and is perceived by inner seeing, inner listening, and inner feeling. It may well be a specialized function of the right hemisphere of the brain, through the right brain's ability to perceive subtle cues regarding feelings and connections. We are guided by what we call insights, gut feelings, and hunches, and by becoming quiet and attentive to our inner thought, we can use the talents of this neglected part of our minds most effectively. You don't need to have any particular belief about your inner advisor to use it, but it's helpful if the technique makes sense to you in one way or another. Whatever you believe, that the advisor is a spirit, a guardian angel, a messenger from God, an hallucination, a communication from your right brain to your left, or a symbolic representation of inner wisdom, it's all right. The fact is, no one knows with any certainty what the inner advisor really is, and we can each decide for ourselves. It can be reasonably explained psychologically, neurologically, theologically, metaphysically, or cybernetically, and none of these explanations are mutually exclusive. I'm satisfied that for many people, the inner advisor is an effective way for them to learn more about their illnesses or problems and the inner resources that can best help them move toward healthy resolutions. How can an inner advisor help me? First and foremost, an inner advisor can help you understand more about the nature of your illness, the part you play in it, and the part you might play in your recovery. Second, an inner advisor acts as a source of support and comfort. Many people experience a sense of peacefulness, of inner calm and compassion when meeting with their advisor. These feelings in themselves are often a real step toward healing, especially if you have been feeling depressed or panicky about your situation. Claire, a therapist going through a very stressful divorce, supporting 2 children, and maintaining a busy professional life, had begun bleeding heavily between her periods. Medication had not controlled the bleeding, and she was set against having a hysterectomy. She broke down in tears as she met her inner advisor, overcome with the compassion she felt emanating from this inner figure. Now, this compassion allowed her to acknowledge how difficult her situation was and how well she was doing with it. Rather than engendering self-pity, this acknowledgement helped her struggle with and eventually come through her crisis with success, integrity, and an intact uterus, which stopped bleeding abnormally. Third, working with an advisor can result in the direct relief of symptoms and recovery from illness. Recovery usually comes as a result of realizing the function of a symptom and making changes so your body or your mind no longer needs to create it. You may find it reassuring to know that while you do want to know what your advisor has to say, you don't have to do anything it recommends. Whatever comes from your talk with your advisor, you'll consider it carefully in the light of day and take a good look at what it might mean to act on that advice. You will evaluate the risks and the benefits of following its advice and then make your own decision about whether or not to follow it. The choices and the responsibility always remain yours. Don't abandon your responsibility to your inner advisor, but consider what it has to tell you. Testing the advisor is something you might want to do if it suggests a course of action that involves some risk to you. Now, let's say that your inner advisor tells you that you have to change your occupation to feel better. Now, while this might be something you'd do if you knew it was really going to improve your health, you might be reluctant to make such a big change without some reassurance. Tell your advisor that you're considering the advice it's given you, but that it's difficult for you to imagine following it. Discuss your fears or your concerns thoroughly. Let your advisor help you understand them more deeply and perhaps help you think of a way to change that takes your concern into account. If, after you've explored the advice in depth, you still see significant risk, ask your advisor to give you a demonstration of its ability to help you get better. I mentioned earlier that Dr. Oyl first introduced me to the inner advisor technique. The first patient I remember him working with was a 35-year-old jet-set entertainer named Eric, who came to see Dr. Oyl with an unusual ankle problem. And once a month, during the previous 9 months, his left ankle would become swollen and very painful for 4 days. He had consulted 3 orthopedic surgeons, all of whom confirmed that the swelling and inflammation in his ankle, but none of whom could make a diagnosis. X-rays of the ankle and laboratory tests on the ankle joint fluid showed no abnormality. Anti-inflammatory medications and injections provided no relief. Eric was a very successful but driven entertainer who worked constantly, frequently flying halfway around the world on tours and jetting back and forth between coasts. He more than loved his work, he was addicted to it, and he had little else in his life. He was actually working or planning new work. He never took vacations and had no outside interest or relationship. His tension was palpable, even at a distance. Eric was enormously angry with his ankle, because it rendered him unable to work 4 days a month. Eric's inner advisor came in the form of a cartoon-like devil, prodding him in the ankle with a pitchfork. It said there was more to life than work, and that Eric had to begin experiencing his emotions. And to do that, he would have to start making room in his life for reflection, and his ankle was helping him do that. Eric was surprised at this message, but felt it was bullshit and didn't see how it could be connected to his physical problem. With Dr. Oil's guidance, Eric struck a deal with his little devil and agreed to take 4 days off a month to devote to rest, relaxation, and enjoyment. His inner advisor told him he would not have ankle pain again as long as he kept his bargain. For 3 months, Eric stuck to this agreement and experienced no pain or swelling. Feeling he was recovered, he skipped his days off the next month, and the problem reoccurred in all its former severity. If you make a bargain with your advisor, make sure you keep it. Remember, you're dealing with a part of yourself, and you can't disrespect it without paying the cost. Consider this a real relationship and treat it with respect. Would you make an important business agreement and casually break it, or stand up a good friend for dinner? Why treat yourself with any less respect? Robert was a 42-year-old man with a chronic abdominal pain and indigestion. He had been diagnosed with pancreatitis. His doctors had little to offer him, but had urged him to follow a low-fat diet, which he had trouble doing. He found an inner advisor who called himself Moshe. Robert said he looked like a cross between his brother Morris and Moses. Moshe, like the doctors, told Robert that he would feel better and give his pancreas a chance to recover if he followed a strict low-fat diet. Robert followed Moshe's advice for several weeks and felt better than he had in years. Then he went on a trip, visiting his family, and forgot about his diet. Soon after a meal at a Chinese restaurant, he had a severe episode of abdominal pain and vomiting. He tried to get back in touch with his advisor, but had no success. When he next came to visit me, I guided him through a relaxation process and politely asked Moshe to come and talk with Robert again. Moshe appeared in his imagery, but stood with his head turned away and wouldn't say anything. Robert asked him why he was silent, and he replied, "I don't have time to waste. If you're not going to be sincere about this, I'm not going to talk to you." Robert apologized and committed himself again to working toward better health more conscientiously. Today, 2 years later, Robert feels that working with his inner advisor has been one of the most helpful things that he has ever learned. Not only has Moshe helped Robert with his digestive problems, but he was also of great comfort during a very difficult 6-month period in which Robert lost the 2 people closest to him. During that time, Moshe told Robert that he was only an intermediary figure who represented his connection with God. Robert said to me, "Why deal with the middleman?" And now in his meditations, he feels a sense of inner connection to God. Sometimes he asks questions and receives answers. Other times he just enjoys a deep sense of peacefulness. If you make and keep your inner agreements, it's quite reasonable to ask for and receive some tangible evidence that what you're doing will pay off. If your advisor is able to guide you toward healing, it should be able to let you know when you are on the right path. There may be times when your advisor may not be willing or able to give you immediate relief as a sign that what you're doing is right. If that's the case, ask it what needs to happen before you can get some relief. Asking this question will often start you on the road that eventually leads to the relief you seek. Remember, testing is not the same as doubting. It's a request for evidence of fair value, and you must give fair value in return. What will my inner advisor look like? Inner advisors often appear as the classic wise old man or wise old woman, but they come in many other forms as well. And sometimes they take the form of a person you know, a friend or a relative who has advised you in real life. These people may be living or dead. It may be an emotional experience for you to encounter them in your inner world. Some people feel strange communicating with the figure of a deceased relative and wonder if they're really talking with the spirit of the person. Now, if you believe you are and you're comfortable with that, it can be a wonderful reconnection. Otherwise, it is enough to welcome it as a figure from your own mind that is wise and kind and that has appeared in response to your request for help. Advisors may also be animals, plants, trees, even natural forces like the wind or the ocean, and sometimes people will encounter religious figures like Jesus, Moses, or Buddha, while others will find an angel, a fairy, a leprechaun. Yoda from Star Wars has appeared to people as an advisor during the time the movie was playing, as did Obi-Wan Kenobi. People sometimes encounter the advisor as light or a translucent, ethereal spirit. It's not uncommon to simply experience a sense of something calming, strong, and wise without any visual image. Others communicate with an inner voice without any visual or feeling image. Dr. David Bressler, head of the Bressler Medical Center in Santa Monica, California, frequently uses the inner advisor technique with people in chronic pain. His approach is somewhat different than mine, and though the results seem quite similar, he guides people to relax in an imaginary quiet place, then asks them to get an image for a friendly creature that can act as their advisor. Many of his patients will get animal advisors such as Bambi the deer or Chucky the chipmunk. Dr. Bressler and I have compared notes at length and agree that people seem able to receive the same kind of information from the animal figures as from any other images. I explained this alternative once to a psychologist who had consulted me but was reluctant to get an inner advisor. As I described the cute little animal advisors many people created, he laughed and said he could see an image of a lion look at him and licking his chops. "Screw all those chipmunks," said the lion. "I'm here and I'm important." From the image he understood that this inner part of himself was powerful and needed to be approached with respect. Try not to have expectations of any kind, since they can stand in the way of your benefiting from the experience. If you are experiencing a transcendent experience and a frog jumps into view, you might not recognize it as a potential inner advisor. The opposite may be equally true. Once, when Dr. Bressler and I were teaching a workshop for health professionals, we led the group through the guided imagery experience of meeting with an inner advisor. Afterward, one woman looked enormously frustrated, and she was upset because all she ever experienced when she looked for an advisor was a beautiful bright light that fills my whole body. And we asked her how it felt to imagine herself filled with this light. She said it was wonderful. It felt healing and energizing. But she was disappointed. She had been expecting a chipmunk. The best way to work with this and any other imagery experience is just to let the figures be whatever they are. Welcome the advisor that comes and get to know it as it is. One advisor is not better than another, and there is no one way for them to communicate. People have learned profound lessons from gremlins named Jack and rabbits named Thumper, as well as from more classical wisdom figures. Some advisors talk, others communicate their messages through their expressions or actions or by changing their forms completely. Sometimes people just get the message without really knowing how. A psychologist at one of our workshops wrote, "I don't see an advisor and I don't hear anything, but I do know what is being communicated." This is the essence of the inner dialogue, whether with an advisor or through any other techniques you'll learn. It may take time to get to know your inner advisor and to understand how it communicates, where it comes from, what it represents, and how best to make use of it. Your relationship with your advisor is a real relationship. Treat it with respect and you'll be pleasantly surprised at how useful that it can be. How do I meet my inner advisor? Meeting your inner advisor is simple. The first step is to let yourself relax. Go to your special inner place. When you're comfortable, quiet, and relaxed there, allow an image of your inner advisor to appear. Accept whatever image comes, whether or not it is familiar. Take some time to observe it carefully and invite it to become comfortable with you, just as if it were real. After all, it is a real imaginary figure. Ask your advisor its name and let it have a voice to answer you. You may hear the name in your mind, or you may just understand its name. Let yourself play along and accept whatever name comes to mind. It's important not to edit or second guess the imagery at this stage. Take some time to become comfortable in the presence of your inner advisor. As you grow more familiar with it, notice if it seems to be wise and kind. Notice how you feel in its presence. If it feels comfortable, ask your advisor if it would be willing to help you and let it respond. If it is willing, tell it about your problem or illness and ask it if it can tell you what you need to know or to do to get better, and let it answer you. Stay open and receptive to the answers that come. Use the following script the same way you have used the previous ones. Now this exploration will take 20 to 25, maybe 30 minutes of uninterrupted time. Script: meeting your inner advisor. Begin to relax by taking a comfortable position, loosening any restrictive clothing, making arrangements for 30 minutes unrestricted time. Take a few deep breaths and begin to let go of tension as you release each breath. Allow yourself a few minutes to relax more deeply, allowing your body to let go and your mind to become quiet and still. Imagine yourself descending the 10 stairs that take you deeper to your quiet place. 10, 9, deeper and more relaxed. 8, 7, easily and naturally. 6, 5, deeper and more comfortably relaxed. 4, your mind quiet and still, but alert. 3, 2, deeper and more comfortably at ease. And 1. As you relax more deeply, imagine yourself in your special place of beauty and serenity, as you did in the previous imagery exercises. Take a few minutes to experience the peacefulness and tranquility that you find in that place. When you are ready, invite your inner advisor to join you in this special place. Just allow an image to form that represents your inner advisor. A wise, kind figure who knows you well. Let it appear in any way that comes, and accept it as it is for now. It may come in many forms. a wise old woman or man, a friendly animal or bird, a ball of light, a friend or relative, a religious figure. You may not have a visual image at all, but a sense of peacefulness and kindness instead. Accept your inner advisor as it appears, as long as it seems wise, kind, and compassionate. You will be able to sense its caring for you and its wisdom. Invite it to be comfortable there with you. Ask it its name. Accept what comes. When you are ready, tell it about your problem. Ask any questions you have concerning this situation, and take all the time you need to do this. Now listen carefully to your advisor's response as you would to a wise and respected teacher. You may imagine your advisor talking with you, or you may simply have a direct sense of its message in some other way. Allow it to communicate with you in whatever way seems natural. If you are uncertain about the meaning of its advice, or if there are other questions you want to ask, continue the conversation until you feel you have learned all that you can at this time. Ask questions, be open to the responses that come back, and consider them carefully. As you consider what your advisor has told you, imagine what your life would be like if you took the advice that you have received and put it into action. Do you see any problems or obstacles standing in the way of doing this? If so, what are they? And how might you deal with them in a healthy, constructive way? If you need some help here, ask your advisor, who is still there with you. When it seems right, thank your advisor for meeting with you. Ask it to tell you the easiest, surest method for getting back in touch with it, and realize that you can call another meeting with your advisor whenever you feel the need. Say goodbye for now in whatever way seems appropriate, and allow yourself to come back to waking consciousness by walking up the stairs and counting upward from 1 to 10 as you have before. When you reach 10, come wide awake, refreshed and alert, remembering what was significant or important to you about this meeting. Evaluating your experience. When you open your eyes, take some time to write down or record whatever happened in your experience. If you met with an inner advisor, describe the meeting in detail. Do you have a visual image or a sense of its presence? Or did the answers come to your questions without any particular image forming? And what did you ask your advisor? What was your advisor's response? Do you understand its response? Are there other questions you would like to ask the next time you have this dialogue that would help clarify its advice? Did you learn anything useful from this experience? Is there any action you will take as a result of this inner conversation? Or is there something else that needs to happen first? Did you become aware of any obstacles to following your advisor's advice? If so, were you able to imagine constructive ways to deal with them? Are there specific people who would be affected if you followed your advisor's recommendations? If so, how could you best address their concerns? If you didn't meet an inner advisor, if your advisor was critical or hostile, or if you met more than one advisor, read the section of the next chapter that addresses your experience before taking the next step. Discrimination and inner guidance. Evaluating the advice you receive is a critical aspect of working with your inner advisor. Now, the advisor is one of the many aspects of your unconscious mind, and it is possible to receive information from other inner sources. Weighing the potential benefits and risks of what's been suggested allows you to analyze what you've learned and discriminate between potentially useful and potentially risky actions. Sometimes, however, the choices that offer the most benefit also involve the most risk. In medicine, we use the concept of risk-benefit ratio to help us decide among different treatments for an illness. The ideal treatment is, of course, completely safe and always effective, but unfortunately, it has yet to be discovered. So we look for the ones that have the best ratio of safety to effectiveness, whether they be medicine, surgery, acupuncture, or psychotherapy. If a treatment is very safe and very effective, we use it more easily than one that is more dangerous and less effective, or even more easily than one that is more dangerous yet more effective. This balance is a critical factor in evaluating treatment choices, one that you can apply in making your own choices. Did your advisor suggest something that seems safe and offers potential benefit? Although you can't always tell in advance whether what's being suggested will be effective, you can usually evaluate its safety. And if it's safe, you can easily try it out to see if it works. For instance, your advisor might suggest that you relax more, or perhaps that you visualize something healing while you're relaxing. Here you are only risking 15 to 45 minutes a day for a few weeks to judge whether or not there will be some positive effect. Now, there may be times, however, when your advisor suggests that you do something riskier, like confronting someone or making a significant life change. You then need to weigh the potential benefit carefully before taking action. Assess your true beliefs about what is important to you and make your choice from the most honest assessment you can make. You might also explore additional options through imagery and have further discussions with your inner advisor about the best and safest way to do what needs doing. One of the most common fears people have is expressing themselves honestly to other people. We fear loss of love or respect, and we can easily ignore our own needs because of this fear. If the needs are important enough, they may find a means of expression in illness or symptoms. Mary, 24 years old, had developed a sinus infection and was afraid that it would spread and get worse. She had several similar infections earlier and always became extremely ill. Her treatment was complicated by her allergic reactions to the antibiotics usually prescribed for sinus infections. So, when encouraged to use imagery to explore the illness, she went into her quiet place and called on her inner advisor, a strong, loving older woman named Rose, who reminded her of her grandmother who had raised her. Mary asked Rose about her illness and quickly became aware of the tension that she'd been feeling between her and her husband during the previous 2 weeks. They were living under considerable financial pressure, and he had been working hard to organize a new business. He was tense, uncharacteristically edgy, and critical of her. He'd recently begun to have a couple of drinks after work, which seemed to change his personality from an easygoing, loving one to a critical and angry one. Mary was frightened to talk to him about it, for fear of making him even angrier. She valued her marriage highly and was afraid to do anything that might strain it even more. She realized all these things in a flash. She had bottled up her own anger and fear. Rose told her that was why she was sick. Mary asked Rose what to do. Rose advised her to talk with her husband quietly and lovingly, let him know about her concerns when he wasn't tense and irritable. After the imagery session, Mary was greatly relieved both emotionally and physically. Subsequently, she had a good talk with her husband during a quiet evening and found him supportive and responsive. They were able to share their concerns and hopes again, and her recovery was complete within 2 days. Mary's inner advisor helped her become aware of the feelings that she was holding inside, the fear that had kept them locked up, and a practical, loving way to express them and get the response she desired. By paying attention to her symptoms in this unusual way, she was able not only to recover from an illness, but to solve an even more serious problem in her life. In this next chapter, I will address some of the most common problems that occur as people begin to work with their inner advisor technique. If you had no problem with your inner advisor, you can now go to chapter 9, where you will learn another method of inner dialogue that can help you deepen your understanding of the meaning and purpose of your symptoms. If, however, you're counseling other people to use this technique, you may want to go ahead and read chapter 8, as you will be able to explain this to your clients. Chapter 8. What to do until your advisor comes and other problems. When people begin to work with the inner advisor technique, 3 problems surface frequently enough to merit special attention. Now, the first is that sometimes no advisor appears, and the second is that the inner advisor is hostile or critical. And the third is that more than one inner advisor will show up. The sections that follow address these problems and the methods that have proven effective in their solution. What if no inner advisor appears? If you didn't meet an advisor on the first try, be patient. Go to your inner quiet place regularly. Relax there and wait with a welcoming, inviting attitude until an image appears. If you do this once a day for a week, you'll find that your inner advisor will eventually show up. Your advisor may turn out to be something that was there all along that you didn't recognize because you expected it to be something else. Or it may be that you simply haven't relaxed enough and are trying too hard. Working with imagery successfully is more a matter of allowing than creating. Just wait in your inner place as if you were waiting for a bus. There's nothing you can do to make it any sooner. Relax more deeply and open yourself. Doing this may in itself stimulate your advisor's appearance. Remember, the harder you try, the less likely you are to succeed. The more deeply you relax, the more receptive you are to accepting whatever comes. The more likely you are to have a good meeting with your inner advisor. I see many people who have spent years trying to develop a backhand in tennis, or learn to hit a golf ball without a slice, and are disappointed and feeling like giving up when enlightenment doesn't come on the first attempt. It's a skill to be able to relax and listen to your inner mind. Be patient and practice, and you'll be successful. Sometimes it helps to perform an imagery ritual while you wait. A nurse I know has a beautiful inner place with a Japanese tea house. When she wants to meet with her advisor, she prepares tea in the traditional Japanese way and waits for him. He always shows up when the tea is ready. A business executive patient of mine hikes through an imaginary wilderness trail to a secret inner spot where he waits until nightfall, builds a campfire. His advisor, an old Native American, appears to him when the fire is burning brightly. Other people go to where their advisors live, in caves, on mountain tops, even on other planets or other dimensions in their minds. If you still aren't aware of receiving answers to your questions, here are some other ways to begin the process of dialogue with your inner wisdom. Number 1. Imagine what your inner advisor would be like if you did have one. Would it be a man, a woman, both, or neither? Would it be human, spirit, animal, plant, or something else? What do you imagine it would look like? How would it move? How would it communicate with you? How would it feel to be with it, to talk with it about your problems? And what do you think it would tell you? What might your advisor ask you to do to begin helping yourself? And how would you respond to its advice? When you've imagined in this way what your advisor would be like if you had one, then close your eyes and go to your quiet place. Imagine that your would-be imaginary advisor is real and there with you, and let it communicate with you in the way you imagined it would. Let yourself pretend that you're having a talk with it about your problem. Ask it questions, and imagine that it has a voice of its own and it answers you. Just accept its answers, for now, as if they were real. Whether or not they make sense, whether or not they are things you will do, just remember what it says and indicates for you to do. Then open your eyes and write down what happened. Congratulations, you have an inner advisor. Number 2, draw or sculpt your ideal inner advisor. Get some crayons or colored pencils and some big pieces of paper and draw your inner advisor. Don't worry about artistic merit. Let yourself draw freely. You may prefer to use modeling clay to sculpt your advisor. Just make up one till the real one comes along. And discuss your situation with your creation. Imagine what it would tell you if it were truly wise and cared about you. Number 3, imagine having a talk with a very good friend. Imagine that you tell your friend in detail without holding anything back about your illness, your thoughts, your feelings, and any questions you have that no one has been able to answer. Tell your friend everything you think is related, including things you've never told anyone before. Imagine your friend listening to you with compassion and responding to you. So what does your friend say? People often think about long-lost friends, or even a dog or cat they were especially close to. Now, if that happens to you, let yourself have an imaginary talk with your friend, dog, or cat, and let the figure respond to you in a way you can understand. Ask it if it will be your advisor, or if it can lead you to an inner advisor that can be of even more help. Another variation of this approach is to imagine that your friend has the same problem you do, down to the smallest detail. Imagine your friend telling you about it and asking for your advice. What would you tell your friend? Number 4, think of it as a historical or mythological figure that fits your idea of what an inner advisor would be. And what would that figure say to you if it really knew you intimately and understood your problem and your questions? Imagine being in your quiet place with this figure, whether it's Winston Churchill, Merlin the Magician, Mother Teresa, Mahatma Gandhi, Eleanor Roosevelt, JFK, the Venus de Milo, Jesus, or Willie Mays. And talk with it about your situation. And what does it say to you? What guidance, advice, or direction does it have for you? Notice the special qualities of this figure. Are they qualities that might help you in your effort to get better? Number 5. Write a letter to your wisest self. Be clear and honest about your situation, your questions, your hopes, and your fears. Ask the questions that are most important to you. Then imagine that you are your wisest self and write yourself a letter back from this perspective. Respond to your initial letter, then correspond back and forth until you feel you've learned all you can about your situation and your options. What if my inner advisor is an inner critic? Once in a while, a person imagines a character who's not kind and helpful but judgmental and punitive. Although you might learn something important from encountering and dealing with a hostile inner figure, it's not your inner advisor. An inner advisor is characterized by being both wise and caring. While your inner advisor may sometimes chide you or point out changes that you need to make, its advice comes from a stance of being helpful and compassionate, not coercive or blaming. If the figure you perceive is heavily judgmental, listen carefully to what it says and how it expresses itself. You will probably notice familiar phrases and expressions, accusations and criticisms that you've heard before. This imposter advisor may be reminiscent of a parent or authority figure from your outer life. In psychoanalysis, this figure is referred to as the judgmental superego and can be very difficult to come to terms with. However, it can be one of the most important inner figures to learn to relate to effectively, since an internalized punitive authority figure can control and distort your life with its constant criticism. Belittling criticism can make you feel like a failure no matter what you do, and can lead you to lose self-esteem, hope, purpose, and zest for life. The simplest way to deal with this inner critic is to assert yourself. Tell it that you are in your quiet place to meet with your inner advisor, a loving, caring figure, and that in this special inner place you are in control. Let it know that you're looking for ways to become healthier and happier, and that you'd be happy to listen to anything it has to say that would be constructive or helpful. Let it know that if it has concerns, you are willing to listen to them and will take them into account. But also let it know that you won't tolerate harping or criticism that doesn't lead toward growth and healing. Surprisingly, an inner critic will often change when addressed in this manner. It may express deep concerns underlying its behavior, often having to do with a desire to protect you and frustration at not being able to. If this happens, you can acknowledge the figure's good intentions and invite it to help you develop ways of living that keep you reasonably safe from harm, yet open to growth, healing, and enjoyment of life. If you have an active inner critic, learn to recognize its tone of voice and characteristic messages. Its inner messages tend to be repetitive and become quite recognizable once you start paying attention to them. Typically, they say things like, "This will never work," or "There, see, you didn't get an inner advisor. You're no better at this than you are at anything else." However, the inner critic phrases it. The basic message is, you're not good enough. Cognitive therapies help people become aware of negative inner messages by having them write them down as they occur. Then have them choose a new thought to replace each habitual self-suggestion. When the person notices herself thinking or repeating her old thought, she stops, mentally cancels the thought, and consciously replaces it with the new self-affirming thought. Over time, the negative thought comes less frequently, and the positive ones begin to come more easily. Recognizing and standing up to an inner critic is important, because the self-image it generates often becomes a self-fulfilling prophecy. If you feel worthless, you will treat yourself as if you are worthless, and it will show in the choices you make that shape your health. The opposite is also true. Dealing with an inner critic consciously and effectively can be extremely therapeutic. Iris, a 26-year-old undergraduate, wanted to lose weight, and whenever she went on a diet, however, she suffered severe periods of anxiety and depression. Her inner advisor was a witch who looked something like the Wicked Witch of the West and something like my mother. Iris had a difficult relationship with her mother, whom she described as overbearing, hypercritical, and interfering. Many years of psychotherapy had made little difference in her ability to relate to her mother effectively. She yearned to be close to her mother, yet ended up in tears and rage almost every time they talked. The inner witch figure was deprecating and skeptical of Iris's ability to lose weight. She laughed when she asked her for help. We made many attempts to enlist the witch's aid and to find out what she had to offer. She persisted in belittling Iris and undermining every attempt she made to help herself. She was critical of everything Iris was doing and offered no constructive advice. Finally, I asked Iris what she wanted to do with the witch, and she responded by imagining herself pouring water all over the witch and watching her dissolve. Just like in The Wizard of Oz, she felt unusually calm and relieved as she considered the pool on the floor. She now felt she had some power over the witch, and she experienced a sense of freedom that was unusual for her. And during the next few weeks, Iris was able to recognize the witch when she heard thoughts of her in her head reminiscent of the witch's negativism. And when she did, she would focus on the image of dissolving the witch and would have a very good feeling every time she did it. And gradually, some unanticipated changes occurred. The witch in her imagery turned into a matronly figure who eventually became her friend. In their discussions, the witch told Iris that she had originally been a good witch, but had an evil spell put on her a long time ago. Iris related this to her mother's upbringing by her grandmother, who was mentally disturbed. Iris found herself feeling more understanding of her mother and much more able to relate to her without losing her temper and feeling resentful. She also succeeded in losing the weight that she had set out to lose. It's difficult to banish an important figure like an inner critic entirely. It may not even be in your best interest. You can, however, order it aside temporarily while you establish a working relationship with a friendly, supportive inner advisor who can become a strong ally. After you've done this, you'll be more familiar with the process of inner dialogue, and your inner advisor can help you deal with your inner critic effectively. Occasionally, an inner advisor will appear as a frightening, although not necessarily critical, figure. While this is unusual, I recommend that you attempt to befriend the figure, whatever it is. The image is there for a reason. Your inner mind created it in response to your question. It may represent the thing you most need to confront and grapple with in order to improve, and may also be the thing you least want to deal with. While the figure may scare you, there are ways to render it more approachable in imagery. You can imagine that you are protected by a force field or by a magic cape that surrounds you and renders you invisible and undetectable. You may observe the figure from this safe place and begin to understand what it might represent and how best to deal with it. You can also have a magic ring that radiates powerful light rays that transform monsters into friendly figures. This will often give you an idea of the positive side of what the image represents. You can have a laser sword or any kind of protective device or shield that can allow you to deal with the image safely. It's often interesting to notice what the shield is made of and what its qualities are. And these may be qualities in yourself that will help you deal with this issue most productively. Finally, remember, it's your imagination, and you can dematerialize a figure by opening your eyes. The idea is to create for yourself an inner condition that allows you to get to know and come to terms with whatever has shown up in your inner landscape in response to your questions. Whatever it is, it's your image. If it's frightening, it's your fear. If it angers you, it's your anger. If it makes you sad, it's your sadness. In imagery, you have an opportunity to deal with these important, perhaps controlling aspects of your life, and you can work with them where they have their effect on you, in your mind and heart. The challenge and opportunity are to summon the inner resources to deal with these issues, thoughts, and feelings, so that you are no longer controlled by them. In mythology, this is known as the hero's journey, and it is the quest we each must undertake in our search for healing. If you find yourself unable to deal with a negative figure, using the approaches mentioned above, you may want to enlist the help of a professional skilled with guided imagery. The most difficult issues to deal with are often the most important ones, and a good guide can help you explore areas where you don't feel confident. What if more than one advisor appears? It's not uncommon for people to have more than one inner advisor turn up, especially after using imagery for a while. Some people have whole communities of inner advisors, each with a different gift. A wise teacher who provides advice, guidance, and clear thinking. A wise elder who provides compassion, understanding, and a sense of loving. A child who teaches playfulness and trust. If your advisor is unable to help you, ask it to refer you to another inner figure who knows more about the issue at hand. Another figure will emerge, often with new qualities, more information, and a whole different perspective. Like people, advisors may have specialized areas of expertise. One of my patients, a school teacher, has 5 advisors that he meets with in his quiet place. They're all relatives of his, some are living and some are not. When he has a question he needs help with, he goes to his quiet place, asks the advisor or advisors who know the most about his problem to step forward and help him understand it. Your whole inner mind is an advisor because it contains a vast amount of information about you and your well-being. It will naturally try to express those thoughts, feelings, and actions that are most important in your life. When you ask for an image of something, whether it's a symptom, an illness, a problem, or a feeling, the image will give you information about that something that you may not have been aware of. So if you feel like it, you can let your advisor change forms or let yourself use many different images as advisors. On the other hand, if you have one advisor that works well for you, stick with it and have it guide you through the learning process. Your inner advisor is a friendly guide to your inner life. With its assistance, you may want to explore your illness and your potential for healing even more deeply. Working directly with your symptoms in imagery will allow you to do that, and you can learn about working with your symptoms by reading the next chapter. Chapter 9. Listening to your symptoms. By now, your inner advisor may have told you what you need to know about your symptoms or illness and how to go about resolving the problem. If so, you may not need to use the technique in this chapter, which helps you to begin a dialogue with an image that represents your symptom. Now, if you would like to know more about what your symptoms may mean to you, or if you are, for any reason, uncomfortable with the idea of an inner advisor, this exploration will be worthwhile. In a sense, you will be eliminating the middleman, as Robert put it in Chapter 7, and attending directly to the source of the problem. You can use receptive energy to help you understand the possible problem or purpose of your symptom and what it will take to allow healing to proceed. In this chapter, I will expand on the idea of a symptom as feedback, describe the most common meanings and functions of symptoms, discuss some concerns and precautions about using imagery to explore your symptoms, and give you a script that will lead you through an imaginary dialogue with your symptoms. While symptoms are usually unpleasant, they are not the enemy. In fact, they serve as a natural warning system that, seen in the right perspective, can help keep you in the best possible health. Symptoms are like warning lights or gauges in your car, and when the oil light goes on in your car, would you take it to the closest gas station and ask the mechanic to rip out the light? Would you tape over it so that you can go about your business and not be bothered? Then why go to the doctor looking only for relief of symptoms? You may miss a warning signal that can help you prevent a future catastrophe. Careful histories of people who come down with serious illnesses almost always reveal earlier warning signs that were ignored or treated superficially. Doctors commonly see patients who've treated their stomach pains for years with medications, palliating, tolerating, or ignoring the signal that something is out of balance until something more serious, like a heart attack, brings the message home. Unfortunately, we are not usually taught that our bodies are intelligent and can communicate with us. We are disconnected from our body language, just as we are from our emotions. We have somehow given away our birthright in the area of health and healing. We have come to assume that, yes, a symptom is a message, but that's all it's saying is, go see your doctor. What would it be like if you were able to understand your symptoms and to use the self-healing intelligence of your body, your feelings, and your spirit? Why not ask yourself what you need and be receptive to the answers that come from deep within? Is it so strange, after all, to think that the intelligence that created your body in the first place would be able to let you know what it needed to be healthy? Whatever created your body, whether you call it God, nature, life, or DNA, was smart enough to create your head. If it can create your head, why not a headache? And if it can create a headache, why not a thought that can tell you what that headache means? Common meanings and functions in illness. Illnesses may simultaneously express a person's distress and represent an attempt to relieve that distress. It's often useful to consider any benefits that an illness may bring as a means of understanding its possible function. In Getting Well Soon, see Resource Guide, the Simonton Group describes the 5 most common benefits that their cancer patients listed when they were asked to identify positive things about having cancer. And they were: number 1, having permission to get out of dealing with troublesome situations or problems. Number 2, receiving attention, care, and nurturing from others. Number 3, having the opportunity to regroup psychologically to deal with a problem or find a new perspective. Number 4, finding incentive for personal growth or for modifying undesirable habits. 5, not having to meet the high expectations of themselves or others. Now, whether these factors play a role in the formation of cancer is unknown, but they are certainly important in the development of many other common illnesses. Further, even if they are not causative, benefits derived secondarily from illness may interfere with your motivation to recover. Identifying the possible advantages of having your symptoms or illness lets you begin developing healthier ways to accomplish the same objectives. And at worst, if you recognize any benefits that come with being ill, you can make the best use of them. Other potential benefits of illness have been identified by many clinical observers. Dr. Gerald Edelstein is a psychiatrist and hypnotherapist in the San Francisco Bay Area. In his book, Trauma, Trance, and Transformation, He reviews and paraphrases the work of another well-known psychotherapist, Leslie Lacron, who suggested that there are 7 common unconscious reasons for the development of symptoms. And they are, number 1, the symptom may be a symbolic physical expression of feelings you are otherwise unable to express. This can be called organ language, having a broken heart, a pain in the neck, not being able to stomach something, getting cold feet, feeling weak in the knees and putting something behind you, and so on. Number 2, the symptom may be the result of an unconscious acceptance of an idea or image implanted earlier in life. Thus the message, "You're a bad girl and no one worthwhile could ever love you," repeated often or under particularly emotional circumstances, could result in poor self-image, depression, self-destructive behavior, and difficulty in relationships later in life. In a real sense, we are all hypnotized as children, and we look to our parents and later to our teachers and peers to define our sense of self. The images we form of ourselves in these early years often form the unconscious basis for patterns of feelings, behavior, and psychology later in life. Number 3, the symptom may result from a traumatic experience that have been highly emotional and then generalized. Edelstein feels that such experiences are often at the base of phobias. Someone badly frightened by a dog, for example, may expect all encounters with dogs to be similarly bad. While these symptoms tend to be behavioral or psychological, they may also manifest physically, as in the case of the asthmatic delivery man discussed in Chapter 7. Number 4, the symptom may provide a benefit or solve a problem, as the Simonton list indicates. If so, a person's focus needs to be on ways to enjoy the benefits without having to be sick. Number 5, a symptom may be the result of an unconscious identification with an important, beloved person in your life. The anniversary illness is a well-known phenomenon in medicine. People may fall sick on or near the anniversary date of someone's death. Frequently, the symptom is similar to the symptoms the deceased person experienced. Now, the identification may also be with people still living or with historical or fictional roles. One patient of mine with cancer was shocked to find through her imagery that as a child she had always imagined herself as an actress playing the role of a heroine who dies a tragic, dramatic death. She was struck by the similarity of the scenario to feelings she was experiencing about her current illness and its effect on the people around her, and she began imagining herself instead as a heroine who overcame and survived this adversity. Number 6, a symptom is often a manifestation of an inner conflict. You may have an unmet need or desire that feels forbidden by family, friends, society, or one's own inner judgments. Now, the symptom may prevent you from carrying out forbidden action or may allow you to fulfill the desire symbolically. Sometimes it does both at once. A priest I once saw as a patient had an extremely painful, immobile right shoulder, and it prevented him from using his right arm and had not responded to extensive conventional treatment. He said it was so painful that he wasn't able to carry out his responsibilities as a priest, and he had asked his superior for a sabbatical leave. In an imagery session, he saw himself angry, righteous, and carrying a placard on his upraised right arm. The anger and the placard spoke directly to grievances that he had with the church bureaucracy that he hadn't been able to express effectively. As he began to share these feelings, he saw how his painful shoulder simultaneously allowed him to stop doing the work he didn't believe in and to express his pain and anger to his organization. He also saw, however, that the message was disguised, unclear, and less effective than it would be if he were to articulate it openly. He realized his need to come to terms with the issues involved, and during the weeks that followed, he was able to clarify his own values, bring his grievances to the proper authorities. His physical healing paralleled his psychological and emotional healing in an almost linear manner. Number 7. Symptoms may be a result of an unconscious need for self-punishment. Now, this dynamic often results from the childhood hypnosis mentioned above, whereby you have unconsciously accepted a message that you're bad and you need to be punished. It may also be an unconscious attempt to atone for a traumatic event for which you feel responsible, or an attempt to prevent something from happening again. Children often feel that they are to blame for their parents' unhappiness, illnesses, alcoholism, divorces, and so forth, and they may carry this unconscious guilt until it is unearthed and worked through. Disguised and under the surface, it may manifest in many ways in their lives, as physical pain, illness, failed relationships, or underachieving. There may be more than one factor at work in the formation of a particular symptom, and there may be factors other than those mentioned. When you explore your own imagery, any of the above dynamics may become apparent, or your symptoms may represent other needs or functions. For now, notice whether any memories, images, or strong emotions were triggered by any of the dynamics mentioned above. They may be helpful clues as you continue to explore the personal meaning of your symptoms. The saving grace of illness, a personal experience. The first time I became aware of the possible benefits of an illness was when I was at the University of Michigan Medical School. I had just started my 3-month rotation on pediatrics and had been assigned to the university hospital ward, where the sickest children were treated. As we made rounds with the chief resident, he told us each child's history, both medical and personal. I was increasingly depressed as I heard the stories of these small children with serious illnesses. I had, at the time, very little awareness of my own emotions. I was learning to be a doctor, and in the 1960s, the medical students and doctors I knew didn't discuss their feelings about illness. Then a remarkable thing happened. As we sat around the conference table after rounds, the chief resident put his head in my hands and began to cry. His crying turned into deep sobbing, and through his tears he said, "I can't take it anymore. I can't stand to see one more kid die." The attending staff physician told us to go home for the day, and as he moved to comfort the chief, the next day the chief resident did quit. The day after, I developed severe nausea and extreme weakness. I underwent the kind of medical workup that is only possible at the University Medical Center. My liver was enlarged, my liver enzymes were abnormal, but everything else looked fine. I had some type of hepatitis. The cause never was identified, and was not allowed to return to the wards until my lab tests were normal. And I was very ill for a few days, then moderately ill for a few days, and I felt fairly well after that, though I tired easily. My liver function test remained elevated, however, for 2.5 months. I had my first normal lab panel the weekend my pediatrics rotation ended. Now, while I never thought at the time that I got sick because of my pediatric experience, I was aware that after a few days, when I was really sick, I was grateful not to have to go back to the wards. If I consider this illness in light of the functions I have reviewed, I can see that it relieved me from a responsibility that I didn't want to have, and it gave me time to think a great deal about whether or not I wanted to continue in medicine. To some extent, I think that I identified with the chief resident, whose feelings and honesty I had admired. Looking back, I have no doubt that this illness served an important function for me. It's often easier to see the benefits of illness in retrospect. It may be useful to you to review previous experiences you've had with illness, before exploring what is happening now. Dennis Jaffe, a noted health psychologist and author of Healing from Within, offers a helpful way to do this. Dr. Jaffe recommends that you take a large sheet of paper, draw a timeline across the bottom with marks for 5-year periods. Above this line, mark important health events in your life, such as serious illnesses, recurrent health problems, and accidents. Above that, note the important events and changes in your life during those periods and notice if there seems to be any correlation between the stressful events or cluster of changes and your health. Be open, receptive, and non-judgmental as you consider illness from this perspective. Few people would ever choose illness consciously for any of the reasons that I've presented in this chapter. Your purpose is to discover what your unconscious response may have been to a difficult situation, so that you can more consciously play a role in your recovery. When you discover the purpose of your symptom, you have a chance to develop ways to fulfill that purpose that may not require you to be ill at all. Using imagery to explore your symptoms. Now, while you may have found that the above list of considerations useful, they are essentially left brain methods of analyzing the meaning of your illness. A simpler, more direct way to understand your symptom is to relax, focus your attention on it, allow an image to come to mind that can represent the symptom, as you did in Chapter 5, and then have an imaginary conversation with it. Ask it why it's there and what it wants from you, what it needs from you, and what it's trying to do for you. The imagery script later in the chapter will guide you through this process in detail. And as you begin to work with imagery in this way, you will need to address several points. And one of these is the difference between a diagnosis and the personal meaning of your illness. I've already discussed the necessity of making sure you have a clear understanding of your medical condition and your treatment options. While no one should be forced to have medical treatment, I believe you deserve the best possible assessment of what conventional medicine does have to offer. Once you understand your condition on that level, however, you need to explore the personal meaning of your symptoms. And to do this, you must temporarily put aside the diagnosis that you've been given. Most people, doctors included, don't realize that a diagnosis is not a real thing. A diagnosis is the way we classify a certain pattern of findings in a given system of medicine. Patients with the same symptoms and signs of illness will have different diagnoses depending on when and where they live and the symptoms of medicine practiced there. For instance, a patient with vertigo and ringing in the ears may be diagnosed as having Meniere's syndrome by a Western physician. A practitioner of traditional Chinese medicine, however, might diagnose the same patient as having yang fire of the liver rising. In another culture, a shaman may say that an evil spirit has entered the sufferer's head. To most of us, the Western doctor's diagnosis sounds the most authoritative and scientific, until we look closely at what it means. Meniere's syndrome is defined as a syndrome believed to be caused by some derangement of the inner ear, characterized by hearing loss, tinnitus, and vertigo, which may be severe and chronic. In other words, by diagnosing your problem as Meniere's syndrome, your doctor's telling you that you have ringing in the ears and dizziness. Now, this diagnosis is simply a label. And in this instance, as in many others, our medical system of classification fails to meet the two most important criteria of a diagnosis. And from the standpoint of the patient, it neither clarifies the nature of the problem, nor does it lead to an effective remedy. And this is why it's important to realize that a diagnosis is a name, not a life sentence. People have widely varying reactions to most illnesses and to most treatments. Now, while there is an average or a typical course of an illness, There are always invariably exceptions that are important to know about. You should learn about the typical course of your illness, but you should also ask your doctor about exceptional patients he or she has known. Do some people do better than others, and what seems to make the difference? If you have a serious illness, then ask if anyone has ever recovered from it, and what's the best possible course of this illness. Will your doctor be willing to support your efforts to recover, or does he or she think they are unrealistic? Hope is a very important component of healing, and there's a difference between hope and false expectation. A patient of mine with breast cancer told her radiation oncologist that she had great faith in him and felt that he was going to help her overcome her cancer. He told her that he would do his best, but didn't want her to get her hopes up. Shocked, she told him, "Doctor, I'm doing everything I can to get my hopes up. Without hope, what do I have?" As Dr. Bernard Siegel, a cancer surgeon at Yale, says, "In the absence of certainty, there is nothing wrong with hope." The point I'm making here is that diagnosis is important because it allows you to assess your medical treatment options. When you use imagery to explore your symptoms, however, focus on your symptoms as you experience them and temporarily set aside what you have been told about your illness. If you have back and leg pain and it has been diagnosed as coming from a herniated disc, then use the pain, not the disc, as the focus of your imagination. If you have an illness without symptoms, then focus on the involved area of your body. Anxiety and resistance. A second concern you may have about using imagery to explore your symptoms is the fear of encountering something traumatic. While this is possible, it seems to be quite rare among people using these techniques. Several thousand people have used my self-care imagery tapes during the past 15 years without reporting a single such problem. Dr. Emmett Miller, a physician in Menlo Park, California, has produced an excellent series of relaxation, self-hypnosis, and guided imagery tapes. With tens of thousands of his tapes sold over 20 years, he has yet to hear of such a problem. Psychological defenses against remembering traumatic events are generally quite effective, and the most sophisticated therapeutic attempts to work through them are often frustrated. If a really traumatic insight were to burst through as a result of using these methods, I would assume that it was just below the surface and would have soon become apparent anyway. Nevertheless, by using imagery this way, you're inviting your unconscious to tell you what's going on inside, and it may well do just that. You need to cultivate an attitude that allows you to look at what comes up and to explore its meanings without judgment or fear. If you feel anxious as you consider this kind of self-exploration that I'm suggesting, pay attention to that fear. How strong is it? Is it mild anxiety or excitement that comes when you venture into a new area? Or do you become really tense, have trouble breathing, get headaches, or experience worrisome levels of fear? If you experience a lot of anxiety, you're probably better off exploring it with a qualified professional. The resource guide on page 251 will help you find a health professional certified in interactive guided imagery who can responsibly help you explore in this direction. One common reason for feeling anxiety is the fear that your symptom may ask you to give up the thing that is closest to your heart or hardest to let go of. Sometimes it will, but often it won't. If this is your concern, remember two things. First, you do not have to do what you imagine your symptom wants you to do. Instead, you will weigh the benefits against the risk, and you will look for the safest, easiest way to use what you have learned from your illness or symptom. You always have the choice of doing nothing and maintaining the status quo. Second, while healing sometimes requires difficult changes, it doesn't always. You may be surprised to find that what is called for has little or nothing to do with what you feared, and your symptoms' need may be easier to satisfy than you ever imagined, and it may bring you the benefits way beyond your expectations. Anne, a 35-year-old writer, had experienced 8 months of recurrent respiratory and intestinal infections, and was frustrated with the repeated rounds of doctor visits, antibiotics that brought her short-term relief, but no improvement in her general health. As we discussed her life, she revealed that she was unhappy about certain aspects of her marriage. Though she didn't want it to end, she was terrified that her illness signaled a need to break away from her husband. We began to work with imagery, and after several sessions I asked her to allow an image to form that represented something that she could do to help herself regain her good health. An image of a large, beautiful oak tree appeared. It was strong, old, stable, and charming. As she sat beneath this tree, she felt calm and protected. Then she experienced an urge to climb the tree. As she reached the top, she found she could comfortably sit in its branches and enjoy a vast overview of her world. She felt this image indicated that she needed to use her inner strength and wisdom to get a better perspective on what was important to her. During the next few weeks, as she examined various aspects of her life from this high perch, she realized that her love for her mate was still strong, but that it needed to be nourished. She saw how she had become buried in worries about money and her writing, which had been sporadic and unproductive. She took steps to renew the warmth in her relationship and found her husband quite happy to have her attention again. Anne was also surprised and pleased to find herself inspired with creative ideas for writing as she relaxed in her crow's nest. 2 months after beginning to work with imagery, she told me that she not only was fully recovered, but was writing productively and felt better than she had in years. She was amazed and pleased to see that out of her attention to her illness had come not only physical healing, but also the restoration of both her relationship and her creativity. If, like Anne, you have more than a little anxiety as you consider exploring your symptoms, it may be best to explore these feelings before moving on. I believe in respecting fear, in treating it as we treat a symptom, not as an enemy, but as a signal that something needs to be considered before we take another step. If doing so feels right to you, then please skip to chapter 11 now, and that chapter will help you clarify your fears and to take a look at how best to deal with them as you explore. Imagery is not just wishful thinking. Another common concern about imagery is that using it may just be indulging of wishful thinking. By imagining your fondest dream come true, by seeing your hopes manifest in imagery, you may fear that you risk being unrealistic and being led down the garden path. This, of course, is certainly possible. Your hopes and fears both exist in your imagination, along with all of your realistic images of life. And if you know that, you are unlikely to be led astray. As always, exercise discrimination. If your imagery of how to go about healing seems too good to be true, you may need to test it, as you may have tested the information that you received from your inner advisor. Though I have described testing imagery before, it is as important enough process to merit a second discussion. To test a vision that seems far-fetched or unrealistic, ask yourself the following questions. What's required of me to have this vision come true? How will I know if it is coming true? Is there any way to track my progress objectively? If I follow the lead of this imagery, what am I risking? Can I establish any safeguards that can protect me, or help me to minimize my risk as I test my imagery? Is the risk acceptable, considering the potential gain? And can I bear the loss if it doesn't work? There are times, of course, when it's just not possible to proceed with absolute certainty. Life is a risky business. There are no guarantees in any kind of medicine or healing. The most sensible approach is not to take unnecessary risks, to minimize those that you do take, and to look carefully at the relative potential for benefits. As you begin to work with the imagery process that follows, you may become aware of negative feelings toward your symptom or illness. These feelings are perfectly natural, and your problems hurt you, frighten you, limit you, and interfere with your life. As you encounter an image that represents your symptoms, you may notice similar feelings arising. Expressing your feelings to the image, then letting it respond, may be the beginning of better understanding, as you will see when you practice the exercise in this chapter. How to listen to your symptoms. I'm indebted to Dr. Rachel Naomi Riemann for developing the larger part of the script included in this chapter. Dr. Riemann originally recorded this script as a part of our self-care tape series. In her introduction to this tape, she explains, if you have a chronic illness, you already have a relationship with it. Now that relationship is often not the best it could be, and may be characterized by mistrust, hostility, and fear. Dialoguing with the symptom or with an image that represents it opens up lines of communication that may have been closed and may lead to an improvement in your relationship. This improvement is often experienced as a decrease in pain, anxiety, or depression. In some cases, as improvement in the illness itself. Expressing your feelings in imagery can be the beginning of a dialogue that allows you to express anger, fear, or sadness. Yet to allow communication to continue, take the attitude of a good negotiator or arbitrator. Discover what the opposing party wants and what it needs, what it will take, and what it has to offer, if its needs are met. Doing this is the essence of the inner dialogue process, and adopting an attitude free of judgment will facilitate this conversation. In diplomatic circles, it's said, there is no good and bad, only opposing views of the good. Maintaining a diplomatic attitude while you explore your imagery may lead to inner peace, where before there was only conflict. Your goal is relief of the symptom or healing of the illness, but your approach will be negotiation rather than warfare. As you work with the following imagery process, allow yourself to relax and accept what comes to mind. Let the images you encounter speak for themselves, and consider what comes to you carefully. Give yourself room to explore by maintaining a non-judgmental, curious attitude. Approach this process as an investigation, a consideration of your problem in a broader perspective. When you are through, you will, as always, reflect on, weigh, and analyze whether you and what you have learned is relevant or important to act on. By now, you know to take a comfortable position and make sure you will not be interrupted for about 30 minutes, and either have a friend read the following script, make a recording of it, or work with our pre-recorded tape. Script: listening to your symptoms. Begin as always by taking a comfortable position, loosening any tight clothing. Have some writing paper and a pen or pencil close at hand. Take a couple of deep, slow breaths and let the out breath be a real letting go kind of breath. Imagine that any unnecessary tension or discomfort begins to flow out of your body with each exhalation. Then let your breathing follow its own natural rate and rhythm, allowing yourself to sink a little deeper and become more comfortable with each gentle breath. Invite your feet to relax and release any tension that may be there. Notice them beginning to let go. Invite your calves and shins to release as well, your thighs and hamstrings, your pelvis, genitals, and hips. Feel your whole body releasing and relaxing as it has so many times before. Just allowing your body to head for a deeper, more comfortable, relaxed and focused state. As your body relaxes, your mind can become quiet and still as well, easily and naturally, without effort. Allow your lower back and buttocks to join in the releasing and relaxing. Allow these large muscles to become loose and soft and take a well-deserved break. Allow your abdomen to relax as well. The muscles of your abdomen, your flanks, and mid-back, relaxing even more deeply. The organs in your abdomen as well, and your chest muscles, your shoulder blades, and in between your shoulder blades, letting go easily and naturally. The organs in your chest, your shoulders letting go, your neck muscles, your arms and forearms, your wrists, now your hands and your fingers and thumbs, releasing and relaxing comfortably and easily, releasing your scalp, your forehead, face, and your jaw, the little muscles around your eyes, and to relax more deeply, to become quiet in mind and body. Imagine yourself in that special, quiet, inner place you visited before. A special inner place of peacefulness, serenity, and security for you. Take a few moments to look around and notice what you see there, what you hear in this special place, any odor or aroma, and especially the feelings of peacefulness and safety that you feel here. Find the spot in which you are the most comfortable and become centered and quiet in that spot. When you are ready, direct your attention to the symptom or problem that has been bothering you. Your symptom may be a pain, weakness, or dysfunction in some part of your body, a mood or emotions that are uncomfortable for you. As you focus on the sensations involved, allow an image to appear that represents this symptom. Simply allow the image to appear spontaneously and welcome whatever image comes. It may or may not make immediate sense to you. Just accept whatever comes for now. Take some time just to observe whatever image appears as carefully as you can. If you would like it to be clearer, imagine that you have a set of controls like you do for your TV set. You can dial the image brighter or more vivid. Notice details about the image. What is its shape, its color, texture, or density? How big is it? How big is it in relationship to you? Just observe it carefully without trying to change it in any way. How close or far does it seem? What is it doing? Just give it your undivided attention As you do this, notice any feelings that come up and allow them to be there. Look deeper. Are there any other feelings present as you observe this image? When you are sure of your feelings, tell the image how you feel about it. Speak directly and honestly to it. You may choose to talk out loud or express yourself silently. Then, in your imagination, give the image a voice and allow it to answer you, and listen carefully to what it says. Ask the image what it wants from you and listen to its answer. Ask it why it wants that. What does it really need? And let it respond. Ask it also what it has to offer you, if you should meet its needs. Again, allow the image to respond. Observe the image carefully again. Is there anything about it you hadn't noticed before? Does it look the same, or is it different now in any way? Now, in your imagination, allow yourself to become that image. What is it like to become the image? Notice how you feel. Notice what thoughts you have as the image. What would your life be like if you were this image? Just sense what it's like to be this image. Now, through the eyes of the image, look back at yourself. What do you see? Take a few minutes to really look at yourself from this new perspective. As the image, how do you feel about this person that you're looking at? What do you think of this person? What do you need from this person? Speaking as the image, ask yourself for what you need. Now slowly become yourself again. The image has just told you what it needs from you. What, if anything, keeps you from meeting that need? What issues or concerns seems to get in the way? What might you do to change the situation and take a step toward meeting the image's needs? Allow an image to appear for your inner advisor, a wise, kind figure who knows you well. When you feel ready, ask your advisor about your symptom and its needs, and any thoughts, feelings, or circumstances that may make it hard for you to meet these needs. Ask your advisor any question that you might have, and listen carefully to your advisor's responses. Feel free to ask your advisor for help if you need it. Now mentally review the conversation you have had with your symptom and your advisor from the beginning. If it feels right for you, choose one way that you can begin to meet your symptom's needs. Some small but tangible way you can feel some part of its unmet needs. If you can't think of any way at all, ask your advisor for a suggestion. When you've thought of a way to begin meeting its needs, recall again the image that represents your symptom. Ask it if it would be willing and able to give you tangible relief of symptoms if you take the steps that you've thought of. If so, let the exchange begin. If not, ask it to tell you what you could do in exchange for perceptible relief. Continue to dialogue until you have a bargain or need to take a break from negotiating. Consider the image once more. Is there anything you have learned from it or about it? Is there anything that you appreciate about it? If there is, take the time to express your appreciation to. Express anything else that seems important and slowly come back to your waking state. And take some time to write about your experience. Evaluating your experience. Take some time to write about or draw anything that was significant to you in the experience. Describe your image of this symptom in detail. How does this image seem to relate to your experience of your symptoms or illness? How did you feel about the image initially? Did your feelings change in any way as you continued to dialogue with this image? How do you feel about it now? What did the image seem to want from you, and what did it say it needed? What did it say it had to offer you in return for meeting its needs? And how was it to become the image? Did you learn anything else about the image from this part of the imagery? As the image, what did you ask yourself? As yourself, what was your reaction to the image's request? And did you become aware of any obstacles or barriers to meeting its needs? If you chose to, how might you deal with them constructively? What would be a first step toward meeting your symptoms' needs? Did the image agree to give you tangible relief of symptoms if you took that step? Is there something it wanted instead? Are you willing to make a bargain with it, or have you reached an impasse in negotiation? If so, you may want to take some time to think about what you consider an offer in exchange for relief. Consult with your advisor before returning to the dialogue with your symptoms. You may not always be able to come immediately to an agreement with your symptoms. As with any negotiation, a good deal of exchange and consideration may need to take place before a bargain is struck. Make sure that any agreement is mutually accepted. One-sided pacts do not work. If you do make a bargain with your symptoms, keep your agreement and watch carefully for improvement. You may notice that as you write about this experience that you become aware of connections and information that you didn't notice during the imagery. And you may even notice yourself becoming aware of related information during the several days following your inner dialogue. You may find information in dreams, in flashes of intuition, in books, from people you talk with, and from TV shows. Once you've asked the unconscious for advice, it will respond in many ways. You may also find that repeating this process in a few days will allow you to penetrate even more deeply into the relationship between you and your symptom. Once you've developed some insight into the meaning of your symptoms, an important question to ask is, what am I going to do about it? Insight can stimulate change, but it may take continued awareness and action over time to make the change a part of your daily life. Psychoanalysis is often criticized for producing patients who understand everything they do but do the same thing they did when they entered therapy. It's not just the knowing but the doing that counts. As Will Rogers said, you may be on the right track, but you'll get run over if you don't move. While in some situations the imagery itself will produce the effects you desire, in many others it will only point you in the direction you need to go. The process of grounding your insight, of using it to make tangible changes in your life, is the key to converting the imagery to the real. Paradoxically, imagery can help even in this down-to-earth step of self-healing that you will learn how in the next chapter.